sure that we get all of this very important discussion in time for our 4 o'clock. We have a council session, so I want to make sure that we have time to discuss everything that we need to. So, Mr. Chair, I'll go ahead and begin. Ladies and gentlemen, we are beginning with our Health and Human Services, Education and Culture joint meeting. We have 2 items on our agenda, and we're actually going to switch them in terms of order. Unfortunately, Montgomery County Public Schools has a Board of Education meeting that is extended beyond the start time of this meeting. So our diversity and cultural competency in mental health professionals piece of the meeting will actually be the second part, most likely starting around the 2:30 time frame, 2 o'clock, 2:30, depending on how long we take with ECEI, our Early Care and Education Initiative update. And so for that, we are joined by Dr. Raymond Kroll, our Director of DHHS. We've got Ms. Phoebe Otero, the Special Assistant to Office of the County Executive. And unfortunately, Dr. Smith won't be here, but I know that we have other representatives from Montgomery County Public Schools to certainly be able to talk about the ECEI initiative and where we find ourselves with the status of that. Back in March of last year was Council President Navarro then, who in partnership with MCPS and Montgomery College jointly announced the launch of the Montgomery County Early Care and Education Initiative, ECEI, the action plan designed to really talk about how we can continue to expand early care and education in the county, understanding that there's such a need to really have quality and affordable early care and education opportunities, and especially under the auspices of the work that she did around racial equity and social justice and our racial equity and social justice law. Because we know how much this means when you look at the opportunity gap that exists when it comes to our children who are oftentimes of lower socioeconomic status and children of color who end up entering kindergarten not as prepared as their white counterparts. And so it's very clear that it starts there, and it just continues to exacerbate throughout the school experience. And so one in which these options and these opportunities actually will make a tremendous difference. So I really wanted to thank Council Member Navarro for her leadership in this effort in really getting this going and really starting us on a path to taking on the opportunity equity gap head on. It really starts here. And so even with our current commission recommendations, of which I was a part of, that's a key tenet, is the early care and education space in terms of breaking down those barriers. So with that, let me turn to Council Member Albornoz, Chair of the Health and Human Services Committee, and then I'll turn to any of my colleagues for any comments that they may have as well.
Thank you, Mr. Chair. I'll be very brief, just to acknowledge the hard work that's gone into this, but also underscore the need that existed prior to the pandemic, but has significantly expanded since the pandemic. And so we have to get this right. And I appreciate everyone's hard work, and I look forward to getting the updated report this afternoon. Thank you, Mr. Chair.
Thank you very much. I was texting Councilmember Navarro to ask it at the same time she was texting me. So perfect. Councilmember Navarro.
Thank you, both chairs, Councilmember Rice and Councilmember Albornoz, and thank you to everyone who is present today to give us this update. This has been an extraordinary collaborative effort, and it is the right thing to do, not just for Montgomery County, but I think that as we now are beginning to even think through the narrative of the role that early care and education plays in so many different areas, one of which, of course, is the issue of economic development, economic competitiveness. With a different administration coming in at the federal level, there are going to be a lot of opportunities to offer that kind of reframing, but then also to be able to share best practices like the one that I think we are beginning to implement here in Montgomery County, and hopefully then states will follow. And so this is very exciting notwithstanding the fact that COVID-19 has really, kind of made us take a detour, I think that the work that has continued to happen has been important. And obviously, as soon as we're able to get back to some normalcy after this pandemic, we'll be able to take this on. But I look forward to hearing the progress that has been made. And once again, just thank everybody for being steadfast and so flexible and nimble to adapt to the newfound challenges that COVID-19 has presented to our childcare providers and generally speaking in terms of early care and education. Thank you.
Thank you very much. Councilmember Glass.
Thank you, Mr. Chair. I too will be incredibly brief and echo the sentiments that all my colleagues just said and just reemphasize that we knew that this is something that we've had to work on for a while, and these crises, the health and economic crises that we're currently in are forcing us to do this even faster and to go even deeper with this work so that we can help more people, more young people. And so I look forward to this conversation and just want to say thank you to my colleagues who've been doing this work for much of their tenure here on the council and before then. So I look forward to this conversation.
Well, thank you very much, Councilmember Glass. And so we're going to go ahead and jump into it. I'm going to turn to Ms. Yao, who is our ECEI champion staff member here on the council, who of course always does a terrific job, but is always pushing us to think outside of the box to really make sure that we're doing all that we can and being a great resource as well. So Vivian, really want to thank you again for all of your great work and for setting up a great packet and lining this up. So I'll turn it over to you to kind of walk us through the presentation today.
I'm going to turn it over in a second to Dr. Krall and BB Otero. They're going to be delivering the update for you. Just so you know, again, as council members have mentioned, the work of the initiative was thrown at a curveball when COVID hit. So you'll hear a lot about what the initiative has done, in terms of recovery from COVID and supporting families and in the community. In addition, there is an EC action plan that for years 2 and 4 that will be released shortly in November, and that will kind of determine the pathway of the initiative moving forward. There's also an MMF update in the packet. The council had approved $75,000 to MMF to do a study on standing up a coordinating entity, and they provided some of the work that they've been doing, so that's summarized in the packet. Unfortunately, MMF had a symposium that's actually taking place at the exact same time, so they weren't able to send a representative to provide an update. And so there's some other information in the packet related to Kerwin and also the Wheaton office building that Councilmember Navarro had requested to be talked about. So on that note, I think Dr. Krall and BB are available to provide the update to the committee.
Thank you, Vivian, and council members. Pleasure to be back with you all today. Before I turn this over, I want to just make an observation that there have been a couple of points of pride. There have been a number of points of pride, times in which I have been incredibly proud to be both a resident of Montgomery County and a member of county government. The ECEI initiative rollout was one of those moments. It was just before I took over as the director of HHS when you all announced this initiative, and it was an incredibly wonderful moment to be a part of that, to be there at the beginning of that, and to be a part of the team that is helping to try to make this a reality. There have been others, but that one was the one that stands out for me, decidedly. COVID, as has been pointed out, has hit everybody hard, and everybody knows that. The child care system was initially hit incredibly hard. We shut it down completely and had to stop that for obvious reasons. The good news is that most of the programs have reopened, not without some losses, clearly. but they're still in business and still struggling to get back on the game and be in and provide the service they need to provide. COVID-19 is still with us and requires that providers keep staff and children numbers small, the numbers of staff and children small. So that adds to the complications and the challenges of the providers, no question. One of the things that has been made possible around this, we launched our recovery initiative early on in this process of COVID to try to figure out how and when we were going to get ourselves back in business. And the groundwork that we've set with recovery that you'll hear about from BB Otero was helped immeasurably by the fact that there was ECEI executive committee working and collaborating and partnering pre-COVID in ways that some of our other areas weren't. So we've had to build things on the fly in some places, but we didn't have to do that with this. So it gave us a natural advantage, and I think that will show up in this summary that BB will give you in a moment. And is also unquestionably aided and accelerated by the appropriations that Council provided to help child care providers and get back on their feet and families to access services. So looking forward to having a conversation with you. So with that, I'll turn it over to BB.
Great. I'm hoping that I can do this easily. It's good to see everybody. Councilmember Joando, how are you? And the rest of the council members, thank you for giving us this opportunity. And I do want to agree certainly with Raymond around the kind of pivoting that we've had to do because of COVID and the amazing work that HHS staff has done around this supporting the early childhood community. It has been as I see around the country and in the region, the work that we've done here is really exemplary in lots of ways. And Councilmember Navarro, to your point, some people have already copied some of it. So it is great to be able to support in the way that we have collectively as an executive and the council, as well as the MCPS and the university. So and the college. So let me. Hopefully you have the PowerPoint. I believe that all of you have it. I'm going to try to go through it pretty quickly because I think Councilmember Rice gave me notice already that I don't have a lot of time, and so I will go through this quickly. So as it was said earlier, on March 27th, MSDE ordered all child development centers across the state to shut down, and then proceeded to support others as they support them back up as they were serving the children of essential employees. As of the beginning of the month of November, about 80% of our child development centers have opened up, which is pretty amazing. That is not the trend across the country. The trend across the country is more in the 50 to 60% at this moment. So I think that's a number to watch out for to see how sustainable that is. As was said a little bit earlier by Dr. Crowell, you have a situation where a number of child development centers that are open, and family child care are open at certainly a much lower enrollment than what they originally are licensed for, and that is having a very significant impact on just the stability of many of our centers. We pivoted quickly, as Raymond said, the fact that the early childhood steering committee existed that was already coordinating across the county and with providers. We already had sort of a structure in place that was able to quickly pivot as a response to the emergency. As we know, that MSDE began to fund child care centers for the children of essential personnel, both for early childhood and school age. And just want to remind you that although we focus a lot on the 0 to 5 when we talk about childcare, one of the things that was really key, and we've met with Councilmember Navarro on this and all, is that our committee also was quickly taking a look at the school age piece, because school age care is also part of that childcare piece. We, as you know, you approved support. Well, I'm sorry, I'm getting ahead of myself. The NDA, out of the NDA, we supplemented some of the payment that the state was providing for child development centers for essential personnel. And what we did was match some of the dollars so that I think the state was provided $350 for one age group and $250 for another. And we added to that, supplemented that the same way as we do the supplementals for scholarship and with some of our WPA dollars. So about $1.2 million out of the NDA went to supplementing payments for about 1,600 children who were the children of essential employees in those child development centers. We also did help coordinate with with all of the folks that were working on the emergency assistance side, the distribution of PPE and cleaning supplies to those programs that were opened up to provide services to the children of essential employees. We quickly took the steering committee, which, as you know, has several working groups, and refocused some of the work to 4 very critical areas: financial supports, communications and engagement, health and safety, and childcare in public spaces and facilities, and assign members of the steering committee to chair each of those subgroups so that we could respond to the emergency appropriately. One of the pieces, of course, was a financial support. The committee, working very closely, obviously, with the HHS staff, put the grant application together and a payment process for the $10 million early childhood recovery grant. There was a great deal, I won't go into detail, but a great deal that went into getting this done, including meetings with providers to understand what would be the best approach to getting dollars to them. And ultimately, we put out 442 grants totaling 10 million and a bit more. And 22% of those grants actually went to those 5 priority areas that we initially discussed as part of the grant process. So I think that was successful. It went smoothly. It went quickly, and we were able to get dollars out the door, and they were significant dollars. And I want to say that because I've watched some of the grant programs in other parts of the country and all, and what we did was a really significant dollar amount that really helped folks be able to, and that may be part of what attributes to 80% of centers being able to open up as opposed to a smaller number. And the second piece was developing the grant application, the process for the school age program for the $1.1 million for school age, which is both a grants program to providers as well as a subsidy program to directly to parents. I think to date, there's about 154 school age subsidy vouchers that have gone out, and another 208 that are serving about 208 children. And there's collaboration with the Children's Opportunity Fund to make sure that if there are children that are in the program that they're working with that qualify for the funding, the voucher program, then we are transferring children to that program. So those are in a nutshell where we are in terms of some of the financial supports. Around communication, there was a lot of working with the state and the county, making sure that we understood what the state was requiring, and helping our folks understand at what the impact at the county level was. Remember, the state went to phase 3 before we did, so tried to make sure that our reopening phases were in sync with what the county was doing versus with the state. And that, I think on a couple of occasions created some confusion, but I think we're fairly clear in terms of the fact that we weren't ready to move to phase 3. We very quickly brought in folks from from health to join the steering committee, and then we're able to get lots of feedback from them and support from them and how to provide guidance for providers around health. We had a town hall meeting June 22nd, as you all know, and we're able to respond to providers. A large part of the conversation in that town hall meeting, as you know, had to do with school age and reopening school age and so on. And so I think we were all responsive to that. On the continuing on the health and safety piece, we continue to provide PPE to providers and as they reopened. That was really critical to make sure that we were supporting them in whatever ways possible. And we are looking at a co-op program for continuing to do that in terms of PPE and using some of the MDA dollars to support the setting up this co-op. There are a couple of organizations that have already started doing this kind of work. And what we want to make sure is that providers aren't having to compete against each other for PPE, and they're going to need this PPE for a long time. It's not just for for the immediate. So we wanted to set up some sort of a system that we can seed, and then providers can, as they recuperate financially and all, can purchase through a co-op model. We also published a reference guide for childcare providers, for centers and for homes, as well as sent out posters that they could put up on their front doors, and really help them with the communications piece, and partially also to make sure that we were standardizing the communication across the county, so that everybody was looking, as you can imagine, when you're running one of these organizations, you're looking at the CDC and an SDE, and you're looking at all the various pieces, and not everybody writes each item in the same way. So the intent of the reference guide was to give a more uniform structure across the county, and that wherever you went as a parent, you saw the same information on the front door in terms of the guidance. And so we got some very good feedback in terms of that. The guide was done in English and Spanish and distributed electronically, as well as sending posters to the providers and providing flyers and things that they could print out quickly to provide to send off to parents. So the other is that we're very cognizant that immunization is a really key piece. Obviously, as school starts, you have to be concerned about immunization. We have lots of children whose parents want to bring them back to childcare, but they have not been able to go to their doctor. They have not been able to get their pediatrician during the summer to fill out their health forms. So really looking at how to work with the Department of Health and publicize the immunization clinics in the Department of Health. So again, getting into areas that we may have not gotten to as the early childhood initiative at the beginning, but these were necessary pieces related to the to COVID. The other, and I give Barbara Andrews a lot of credit for just from the very beginning talking to folks on the public spaces piece, as well as both the CUFs and the HHS spaces, and trying to make sure that we had them ready to go, and of course working with MCPS on this, we had them ready to go when providers were ready to open. And so the cleaning piece and supporting that with DGS and others, as well as making sure that both the child care centers that are in public spaces, as well as the child care school age that are in school buildings. So all of that required a lot of coordinating, and Joanne Barnes on the school age side and Barbara on the early childhood side really helped coordinate and bring people together to meetings from the very beginning. We had that, as I said, we had that conversation with Councilmember Navarro early a couple of weeks ago, where we shared with her all of the conversations that have been had across systems and across programs to coordinate all of this. So I think what you've seen in this is that this early childhood initiative steering committee has really served a really one, to quickly be responsive, and two, already having built the coordination across city agencies and providers, it was a really, we were able to move quickly. And I think you see that in the number of areas that we worked on. That said, before I go to the next slide, I do want to reiterate that this is a business, a system, a set of programs that are really fragile right now. Not just in the county, but in the state and across the country, because of the reduction of group sizes, the fact that most child development centers, family child care homes, barely make ends meet. They have zero to no profit, and they have zero to no reserves. And so in places where your subsidy continued, because the federal government allowed the federal government subsidies to continue to flow to providers even if they were closed. And so the subsidies from the state continued to flow to providers until, I believe it was until June. And we did the same with our WPA. In those cases, the providers were receiving some dollars and being able to keep their staff. In many cases, staff have had to collect the unemployment and then come back. So we could have a whole other meeting on sort of the challenges that we see coming down the pike and the importance of having this coordinated effort across all of the county agencies and certainly within HHS and others to make sure that we can rebuild the system, because it's going to require a significant amount of work in rebuilding. And as Councilmember Navarro said, the new administration, if any of you have had a chance to look at their platform, there is a very strong platform on early childhood. And it will be a while, but I think there will be some resources coming down the pike at the federal level. So whatever we can do locally to keep our system in place so that it can then be reinforced by what we get at the federal level will be absolutely key. And finally, as Vivian stated, the action plan, we did not stop our work, all the other work in the Early Childhood Initiative. The action plan is ready. You will see it next week, and we have shared it with the principals, and it is really going to focus primarily on the sustainability, access, and affordability piece that are critical in light of the pandemic. So I again want to end by really thanking all of the members of the steering committee, all of the staff at HHS, and the amazing work. And I would be remiss if I didn't thank Jennifer Anaz for her incredible work in terms of constantly sending out information to providers and having that e-blast that she does on a regular basis and keeping providers informed. We had several Monday night forums with providers in English and in Spanish, and it was really, really, I think, helpful. I'm sure there's still some who feel that we haven't done enough, but I think that we were able to respond fairly quickly given how significant this emergency has been. So I'll end there, and I don't know if you're taking questions right now or do you want us to wait?
So yeah, I actually think this is a great opportunity once we're done with this one to go ahead and open up for questions. So let me turn to Councilmember Navarro. I've got her on my list.
Thank you, Mr. Chairman, and thank you so much, Bibi, for that presentation, Dr. Kroll. I guess my question is a little more general because I was trying to discern from your presentation, and I totally understand that we're dealing with, the emergency of the pandemic, and we have to prioritize that. But can you give me a sense of where you are vis-a-vis the goals that we stated in the action plan, and what is your overall assessment? And you said we could have another session on this, so I would welcome one. But just very, just very generally, what is your assessment in terms of what you think, how this has affected then our progress in terms of those particular goals, and whether you believe that we're going to have to amend or shift some of those particulars, the goals that were contained in the action plan that obviously have been totally affected by the pandemic and our need to respond. Can you just give me just a general sense from your vantage point,
Sure.
what are we going to have to do?
Sure. So if you remember the action plan, when we started last March, a year ago March, we set goals for year one. We pretty much accomplished all of the year one goals. And the idea of the action plan was to then set up the goals for the next 4 years or 3 years, right? And so you'll see that in the action plan, right? The very specific goals. Year one, we were able to, the pandemic literally came in a year after we had so we had reached more seats than we had added more seats than we had expected. I don't have the exact number for you, but certainly we had accomplished that. Although right now we don't know how many of those family childcare providers that we recruited, got licensed and got set up, how many were able to open in time or stay open once, to reopen once the pandemic, MSDE allowed them to reopen, how many are open close. And we're trying to track down that, but it's going to be I think it's going to take a little bit, because I think some folks aren't open just because they're not ready to open, and some folks may not be open because they will not reopen. And we're seeing that I'm certainly seeing that in other places. So the first thing I think we're going to have to do is really assess where those providers are, those family childcare providers where we added seats. The other place where we were adding seats was MCPS, and of course Emory Grove had to close like all of the other schools. Our Family Involvement Center, that was part of the Emory Grove model, has continued to be in touch with parents, as have MCPS staff to the families of the children that were in the childcare and the preschool program. And so we do have information on how many of those parents have continued to attend. They've been attending parent meetings. They've been engaged, and I give our Family Involvement Center staff a lot of credit for doing circle time and all of that via Zoom with babies. And I think you can see some of them on YouTube if you search for them. So those things have continued to move forward. Certainly the supports around anybody who was thinking about expansions, some of those have sort of slowed down a bit, as you well know. And we'll pick those up as soon as people are ready to. And so the action plan you will see in the action plan that there are activities moving forward that, in spite of COVID, we can continue to move forward on. And I do really, especially now that we have a new administration, I am much more hopeful that we'll be able to move ahead in terms of that. I hope that gives you
Yes, no, I appreciate that, and I definitely look forward to continuing to work with you to track all of that. And Mr. Chairman, I don't know if we wanted to now address also the issue of the Wheaton childcare space, if that's okay. Just wanted to understand where we were with that and preface my question with just acknowledging that I know sometimes things kind of take time, and there've been some barriers that have been identified. I know DOT had, Ms. Otero, you had shared something about, some storm drainage. I brought that up directly with Mr. Conklin. They looked at that. They believe that is easy. They can easily modify that. But what I want to say, especially for my colleagues, is that I feel like this is a prime opportunity, precisely because we're dealing with a pandemic, to then, overcome whatever barriers there may be, so that once we start kind of revamping, again, this is such a high priority for, I know, the county to identify, public facilities, and that's why we wanted to incorporate this space. When this, construction was happening, we were adamant about that. And so I'm really bullish about the fact that, we thought ahead to include this. I do not want to just have that space sitting there when we know the need is great. So in some ways, I feel like this moment of this parentheses can give us an opportunity to just address whatever issues, so that we can quickly identify, a provider, and then be ready when the time comes for that space to be there to serve families. Prime location next to Metro. I mean, there's just so many things But just wanted to kind of understand where we are and when we might be ready for. I know I've heard some estimates of maybe spring or 18 months or something. Just want to know where we are and just to, again, express my appreciation, but also my sense of urgency that we should really get that going so it can be ready to serve families and babies and toddlers and all of that.
If it's okay, let me start it and then just have Karen and Gwen pitch in. But we started working with Karen. I don't know how far back in terms of after the initial RFP that did not get many responses for child development centers. We have been working, and Barbara Andrews in particular, have been working very closely with Parks and Planning around what was hoped to be an RFP in the spring, which of course did not occur. And what I understand right now, and then I'll turn it over to Karen, to Karen or Gwen, is that we need to understand where child development centers are now. So there is a meeting scheduled with child care directors to see what else they need to see on an RFP and what additional, given the pandemic and given the changes, is there something different than what we had already agreed to and planned? And then based on that, working together on an RFP so that the whole process is really a collaborative process, so that the expertise from early childhood on the side of HHS is made available as Parks and Planning moves forward. The one thing that we all know is that it's on the second floor. It's not babies. It will not be an infant center. But all of the initial pieces that really were in our way, which had to do with getting adequate playground space. So once that hurdle has been, as you said, that we were able to get past that hurdle, I think I'm really delighted. The collaborative effort and the working together around this is going to be key. And it'll be a good example for other possible expansion opportunities, both in the private sector as well as public buildings as well as private buildings. So I'll let Karen and Gwen.
Yeah, if I could, this is Gwen Wright, and if I could just say a few introductory remarks, and then I'm going to turn it over to Karen Warnick, our Management Services Chief. I want to first say we are absolutely, completely, and totally committed to this daycare center. In fact, for some of you who are on the council at the time, you may remember that we argued for this daycare center. There were some who thought we shouldn't do it, and we argued vociferously to have this daycare center, and we feel really, really like it's very important. We have been working diligently and trying to make the whole project come together. We've had several hurdles, including the need to find additional outdoor play space, which I think, again, we've resolved. The need to find some additional funding to help with the build out of the space, which we have identified some funding from our own coffers. And now, of course, the other hurdle we've all been dealing with is COVID and the shutdown. But we have not stopped working. We are ready to launch back in to working to find a partner and to build out the space. We also do not want it to be empty, unoccupied space in our brand new building. We really want it to move forward. And so I'm going to go ahead and let Karen Warnick, Chief of Management Services, talk about what she has been doing to implement this.
Great, thanks, Gwen. As she said, I'm Karen Warnick. We put out the initial RFP 2 years ago. It was in the fall of 2018, and we got 0 bids. Like, nobody was interested. And so we regrouped, and in the March of 2019, we did an outreach event and asked vendors, why didn't you bid? And so one of the things was that we are requiring them to build out the the whole facility. And as Gwen said, we said, all right, well, we can come up with $500,000 to help build out the facility. It's still going to, our estimates that we've gotten to build out the facility range from between 1 to 3 million. So it's still going to be, and the answer is probably somewhere in the middle. But it's still going to be a stretch for some vendors to be able to come up with that kind of capital in this day and age right now with what we're dealing with. And with the build out, when I was talking with our architect supervisor, she was saying that it's very difficult for people to find supplies and materials in particular, and to find workers to work on construction sites. So that's what's really driving up a lot of the costs right now. She said they can be up to 3 times as high. But some of the other things that we had talked about with the vendors was we had originally had a common area maintenance fee for them that we charge to all tenants in the building, and we said we'll eliminate that. We'll negotiate with them on the rent. We will provide custodial services for them. We will also provide ongoing maintenance. The only thing that they may need to provide is like specialized maintenance or specialized custodial care for child care locations. We also offered them working with MCDOT, Jeremy Souders, I believe he's on the phone. Also that there'll be in-building drop-off and pick-up parking, like for 20 minutes for free, where they can do that, so that their clients won't have to pay for parking. And we also extended the term of the lease. Initially, we were looking at 10 years, and we've now said, all right, fine, we can extend it to 20 years to help them with their financing and to make that more doable for the vendors. The 2 other areas, one was the outdoor play area. And again, MCDOT has worked very well with us recently. There was an issue with the drainage, but they're again going to work with us to make that outdoor play area work. And so now the only thing that's really kind of, I think, any kind of a stumbling block to this is really just going to be the financing. If they're going to have enough financing capabilities to bid on this project. From a timeline standpoint, what we're going to do next is have another outreach meeting. It's scheduled for Tuesday, December 1st from 1 to 2:30. We have already sent out flyers to Barbara Andrews, who she and I have been working back and forth for this for several months. She sent it out to all the directors in her list. We sent it all to all the folks that had bid on the project before, at least expressed interest in the project before. And I've already gotten back responses from 10 or 12 vendors that they want to attend this event. We're going to have just an overview of the project, overview of the child care services project. And we're also going to have folks from Department of Permitting Services come and talk about the requirements of operating a child care on the 3rd floor, which is a little unusual, as BB said, is really going to limit them to probably a preschool as opposed to having infants. We're going to have someone from the Maryland Department of Education Office of Child Care to talk about licensing requirements, and that has to do a lot with the playground. Was a big issue the last time. They said, unless you can assure us that we can get the licensing with the playground, we wouldn't even consider looking at this project. So we'll have someone there to address that. We're going to talk about an automatic exception for the play area to see if we can get like 100 children in this facility, because that was another issue that folks had said that, we originally were looking at trying to get 60 in the facility, and we heard that that was just not quite enough to make it doable. So, and then we're going to talk about the general stuff, the RFP process, the lease term, the rent, the drawings, and the build out, and then do a question and answer. So assuming all of that goes well, and that we, hear positive things back, and that that vendors would have the wherewithal to bid on this project, we anticipate putting out the RFP late January, early February, in that range. We would like to give them 6 weeks to for the bid, for the RFP to be out, so that gives them additional time to put their financing together and their whole project together. And then we'll take about 4 months to evaluate proposals, select the vendor, go through negotiations, and then build out would be about 18 months, because they're going to have to do design, the permitting, fire marshal, licensing, construction, and all that. So, and I've even been told that the 18 months is probably maybe doable, but very tight. And so That all adds up to about 2 to 2.5 years from the time we put out the RFP to the time that the child care facility would actually open.
And I want to emphasize, we aren't dictating or telling them it has to take 18 months for you to build out. If they can build out faster than that, great, that's fantastic. We're just trying to offer what we've sort of understood as a rule of thumb of how much time it might take to build out a project of this size.
Right.
You know, honestly, it sounds a little long to me. We're only talking about 6,000 square feet. And I think about retail businesses that have leased unfinished space, and I feel like they built out in less than 18 months. So we're not saying it must be 18 months, but we're giving you the information we're hearing from other experts who have been through this. It may take less, it may take more, but I think what we're trying to do is get the RFP out as quickly as we can and get responses, make a selection, find a good partner, and then let them proceed.
Thank you so much. I'll just close by saying that, of course, as we identified in the Early Care and Education Initiative Action Plan, one of the components was this notion of trying to do whatever we could to identify public facilities where we could then, provide childcare, expand our slots, make sure that it's geographically accessible, affordable, high quality. And that's why this was such an important decision that was made to incorporate this space, which I would just offer that looking at this is just sort of like a market rate kind of endeavor may not work, but hopefully, just kind of putting this out there for my colleagues, hopefully we can have a conversation about the fact that this is an area where you have a lot of low income families. This is an area where you could, it is geographically accessible. It can be made affordable, and it fits very nicely with our policy goals, which is to expand the availability of those types of slots to families in that income range, which we may then could have a conversation about whether we need to rethink the partnership and how maybe, government subsidizes this considerably if we're able to then, for example, require that there would be a particular percentage of slots that goes to like low income families. So I just throw that out there because that was really, to be honest, that was the whole impetus behind this. And I would just be super sad if it just becomes this super commercial endeavor that doesn't work out and we miss out this opportunity to provide this very important service to families that would not otherwise be able to access. So just wanted to share that as food for thought.
Ms. Otero?
I want to reiterate or agree certainly with Councilmember Navarro and say that is exactly what has been behind the Early Childhood Initiative being a part of this, because as you all know, the Early Childhood Initiative is really focused around expanding access and affordability. And so we have, in the conversations with Karen, I know that we've talked about the fact that any child development center that opens it, that takes this on is going to both need support on the capital side and on the operating side, and the startup. And so there are, which is why I think waiting for the December 1 meeting and really hearing from where folks are who may have before had a little bit more resources and now don't, where they are in terms of what needs. I also want to really acknowledge the flexibility for parks and planning as we raised all of these issues around drop-off and around shared common spaces and so on. They were really flexible around thinking about those issues as we talked about them. So I want to acknowledge that there's been a lot of movement on parks and planning around that and Karen's work. But I think that we, and certainly we've had the conversation already in terms of utilizing WPA dollars, in terms of subsidizing some of the children and so on. But, and moving to 100 children is going to be key in terms of sustainability for whoever opens up that site, because we know that under 100 children, it's really hard to to financially make ends meet. So all of that is at play, and we're really cognizant that the key will be that this is a really good example of how we can do subsidized care along with market rate in a given setting. So I think really important for us to keep an eye on that one. So want to agree with Nancy on that, and that is definitely the intent of any expansion project that we get involved in as part of the Early Childhood Initiative.
Let me just say that I think that that's terrific. And before I turn to Chair Albornoz, it really is something that's important. One of the things that certainly comes out of this discussion for me is that we have to ensure the communication interdepartmental still continues, and that folks are talking about some of the challenges as well as the opportunities that exist in terms of being able to knock down those barriers and be able to continue making these projects come to fruition. And so I just really want to encourage that. I know that it's hard. Oftentimes we get stuck in our own silos of HHS or transportation or recreation or wherever and don't think about that other piece of it, but it is incredibly important. So Chair Albornoz.
Thank you, Mr. Chairman. Within the context of the recent executive order that we unanimously passed on Tuesday, in the rollout, there was some confusion in the child care provider community, which I credit the administration for reacting to quickly and addressing and cleaning up. But within that context, all of our offices received dozens of phone calls from childcare providers, not just about the executive order and that situation. Every single one of them, all of them, even the larger ones with multiple locations, indicated that they were close to or about to close a number of programs and facilities because they are on the verge of financial ruin. And so the Medical Society conducted a survey of its members and provided some data and analysis that served as the basis by which we appropriated funds to help our medical practices. Has there been a survey done to better quantify, and if there has been, and I missed it, I apologize, but has there been a survey done to quantify where our providers are now, how many of them are at risk of failure in the next 3 months, 6 months, because obviously that has potential catastrophic impacts for infrastructure moving forward. And just, I know we're tracking this, but how formally are we tracking it?
I don't know if who from the team is on, because I think
maybe Barbara is on. I don't know if she's watching or not.
I know that we have been tracking it. Councilmember Albornoz, we've definitely been tracking it. The one thing, as I said earlier, that it's not just unique to us, but to others in this sphere across multiple states and all, is not having providers not ready to say I'm shutting down. They're saying I'm not opening yet. Right? People are not, so there's some mixed messages around that we, I think we'll get a better sense about when schools open up, when we're still in phase 2. So what happens when we get, and of course now we know that we're even, things are even getting tighter, but it is the same phenomenon that is happening everywhere else. As I said earlier, I think we did a really good job in a lifeline in terms of the $10 million. That other jurisdictions were not able to do. And I think we provided some of the lifeline in terms of that. There is not enough money out there to make this whole business across all jurisdictions survive fully, which is why what worries everybody right now. And short of a significant federal infusion in terms of specifically through the child care community, it's going to be really, really difficult. And it's going to require us to rebuild the whole system. Barbara can speak a little bit more to the conversations with providers, but I know that we've done a couple of surveys with providers around different pieces of their needs and so on. So I'll let Barbara.
I just add, Bibi's right. We have consistently had people not want to say that they are closing. That's not a question that they want to answer. And the other piece that's kind of hard to get a hold of is enrollment, because it changes constantly. So you'd literally have to call providers every single day or every week to find out what their enrollment is. But what we generally know, which was on one of the slides, is that 80% of our programs have reopened, but that in most cases, I don't have the number in front of me, but in most cases, the enrollment that they're meeting, they're not even meeting the lower enrollment that they're allowed right now. There are some programs that I think are in certain areas that have talked about turning parents away because they can't have full enrollment right now. But that's a major issue, and it does seem to be that parents, maybe the parents that have a choice are not sending their children back to care yet, or that some families have extended family or are making other decisions at the moment. I think that is particularly true of infants and toddlers.
I want to agree on that totally. Again, I track a lot of the regional and the national work as part of the way of my work. And what we're seeing is, although parents are really concerned about childcare, when the time comes, they're not so willing to put their children in care with a large number of children. And one of the things we're going to have to look at and really gauge is what kind of a setting are parents more comfortable with as we get back in. Is it mostly family childcare for younger children and preschool and for older children? Classroom settings? I think it's going to be really important, and I think your question, Gabe, is exactly the right question for us to be gauging constantly. How is this system going to have to change, not only in Montgomery County, but everywhere else, in terms of where parents are comfortable and what they want, our workforce coming back, because our workforce is by and large women of color and older women, and whether they feel safe coming back. So there is, and then just the business aspect of being able to hold on to your business, and where in that is the investment best? Is it investment around operating dollars? Where, or is it around subsidy for children? What is the best way? And we're doing, I think, a really good job to Craig's point about coordinating across agencies and across systems to make sure that we are taking advantage of everything we have out there and every possible options that there are. And again, having had the Early Childhood Initiative in place, and as a coordinating body around this, has really been a very positive piece to get us to be on top of it as much as we can be.
Well, I appreciate that response. I know it's a moving target. I do think there'd be some value in issuing a survey to have a better sense of scope. And then I think there will be another round of federal stimulus available. And I don't think that's just being Pollyannic or optimistic. The only question is how much and when. And so I think it would bode us well to have more information up front so we can be more strategic in the dissemination of the funds so that they go where they're the most needed immediately, take the lessons learned from this last round, and put people in the best position to succeed. Because as these organizations were speaking to our offices, they were not bashful in saying that when they were going to close. I mean, all of them had a specific date and acknowledging some of these the moving elements to this. It was pretty clear. So I think that might be helpful. Two other points really quick. On the more optimistic side, well, sort of. There is a tremendous amount of commercial office space now vacant and available and will not be filled anytime soon. In downtown Silver Spring, I recently saw a report that we're at over 34% vacancy, and that number is climbing, which ultimately it's going to have catastrophic challenges for us economically. But maybe one of the small silver linings is it will open up additional space available as we scale up, which was an important component of the strategy that Councilmember Navarro put forward, looking creatively for different locations. There will be more options. And so we should look at potentially identifying a fund, a capital fund, so that we can take advantage of that quickly, convert space quickly, do a public-private partnership. One of the reasons why so many of us are so supportive of the MMF proposal is because it is very intentional in bringing our private sector to the table. Let's leverage that. Think very creatively about establishing a fund that we could stand up and have shovel ready, so that when the stimulus is available, we can get going and ride that wave. And then finally, the education hubs, which are awesome and have tremendous potential, and acknowledging their challenges, in certifications of childcare, but you've got siblings who are coming to these locations and can't bring their younger or brother or sister with them. But families are in need of that holistic approach. And so I think it's something that we should look deeper into, acknowledging there's probably going to be some additional layers of cost. But because of where we are in this phase, and that threshold, which I agree with, that has been set to reopen MCPS, we haven't hit that threshold since the beginning of the pandemic, and the numbers are going up, not down. So this is our new normal for the foreseeable future until a vaccine becomes available. And we should look at the feasibility of adding multiple age children within some of these education hubs to address the holistic needs of families. And that leads me to my final point, and that is vaccines. I think that childcare providers should be in tier 1 if they aren't already. Once vaccines are available and ready for dissemination, obviously we got to get them to frontline healthcare workers and frontline folks. But this to me is frontline. I think everybody on this call agrees. And so if it's not already specifically stipulated in the recommendations, it needs to be. Because this is going to be critical to reopening. So with that, I yield back to you, Mr. Chairman. And I know we're running short on time to transition to the next discussion, so we can try to meet that 4 o'clock deadline. But I appreciate your leadership as well.
Well, thank you very much, Mr. Chair. And I think that, again, you brought up some very good points about what it means for us in the future and how we're going to continue to try and shape the direction that we had in delivering, again, what we said at the beginning, high quality early care and education for our kids, even in the midst of a pandemic. And so, because as Councilmember Navarro and I were having a discussion the other day, and just saying that, COVID-19 is one of the things that hit us now, but we've had multiple things that have always affected us and thrown us off kilter. This is one that happens to be a global pandemic, but there are so many things that are interrupters, whether it was the unfortunate recession that we had and how we had to press the reset button, right? So there are always going to be these challenges that are there, but it's thinking about how to be resilient, how to get past those. I think those are the things that are really important for us. So just really want to thank you, Mr. Chair, for continuing to push us forward and really pressing about how we can continue to think about this and really continue to expand. So Vivian, were we going to do something around Montgomery moving forward, or are we good to go there? Okay, that was just information in the packet for us about the status and update. Excellent. Well, with that, I don't see any other questions from any of my colleagues. So I really want to thank you, Ms. Sotero. I want to thank you, Dr. Kroll. I want to thank all of the partners for all of the great and continued work. We know this is not easy, and it's a tremendous challenge, but it also is incredibly important. And so we know that you'll continue to keep pressing, keep pushing for all the different ways in which we can continue to deliver on this overall goal that we all agree needs to happen. And it is my hope, again, as you heard from Councilmember Albornoz, you heard from Councilmember Glass, you heard this from Councilmember Navarro, we are upon a new administration. And I do think that there is a greater appreciation for the importance of education with this new administration. And with that, hopefully will come additional dollars of support from the federal level and then even at the state level when it comes to the Kerwin Commission and the overriding of Governor Hogan's veto, which, let's just put this in perspective. If we had had that money to help stand up early care and education, a lot of our local businesses who are providing this early care and education for our children would have been able to potentially survive. I'm just being real about this. I mean, because they would have been in a much better and more stable financial situation than they were. And we know that these margins are thin and a lot of people are struggling. And so having that sort of help and support from the get-go leading into the pandemic would have been much better for these organizations than trying to give it to them now when many have shuttered their doors. So that's just a reality of where we stand when it comes to politics and people playing games, when it comes to people's lives and livelihoods. So it's unfortunate. So, all right, we will move on to our next item. And our next item is, again, part of our joint committee work session on diversity and cultural competency in mental health professionals. And so this is something that, unfortunately, based on the COVID pandemic, we've talked a lot about, which is mental health. But the reality is that with the extension of that, what are the cohort of people who are providing those types of services, and how can we make sure that they better reflect the community that they are serving? But also, it's more than just that, but it's also how can we actually be a part of the pipeline to help solve the challenge of us not having people of color that are representative of what we're seeing in our community, serving our community. It's certainly something that we're challenged with across the board, whether it's dealing with our police and fire, so public safety, whether it's dealing with some of our county employee departments. The reality is that across the board, we see these kinds of challenges. But one of the things that I feel that we do really well here in Montgomery County is take it head on and say, how can we not only make it better, but then also create a pathway that allows for us to be even more successful in terms of getting people of color into these types of careers. And so I'm very excited that we have a very, very robust group who's with us today. And so, of course, starting off with our Department of Health and Human Services, we've got Dr. Kroll, who's still with us, Dr. Rolando Santiago, who is our Chief of our Behavioral Health and Crisis, who's newly, I think you've been here, Dr. Santiago, for maybe a month now, somewhere around there, so pretty new. We've got Ms. Joanne Barnes, Chief of DHHS, Children, Youth, and Family Services, Ms. Monica Martin, who's Administrator for DHHS, Child and Adolescent School and Community-Based Services, Jordan Hill, the Administrator for DHS, Trauma and Crisis Services, Susan Sailing, Chief of Human Capital Management, Organizational Development, and Carmen Sands, who's the Program Manager for the Welcome Back Center. Then, of course, within OHR, we have Mr. Teal Burke, who is the Director of OHR. And then we have Samuel Fusher, who's the Special Assistant to OHR, and Melissa Davis, Chief for Recruitment and Selection. And from Montgomery County Public Schools, we have Dr. Jack Smith, our Superintendent. Dr. Smith, good to see you. I know you're fresh out of MCPS. We've got the MCPS board meeting, so thank you so much for joining us, as well as Dr. McKnight, our Deputy Superintendent, Karen Stratham, who's the new Chief of Staff. But I think Henry's also on the Zoom as well. I saw him as well. Dr. Janet Wilson, Chief of Teaching, Learning in Schools, and Dr. Helen Nelson, Associate Superintendent of Human Resources and Development, and Ms. Rochelle Rubin, the Associate Superintendent of the Office of Student and Family Support and Engagement. I'm almost done. Montgomery College, we've got Dr. Sanjay Rai, who's our Senior Vice President of Academic Affairs, as well as Dr. Monique Davis, the Dean of Health Sciences and the Director of Nursing, and Mr. Steve Greenfield, who's the Dean of Business, Information Technology, and Safety. And last, and certainly not least, our universities at Shady Grove, with Dr. Joan Pittman, our Program Director for the UMB School of Social Work, and Ms. Katie Morris, Program Director for UMBC Social Work Program. And then I know that we have Ms. Shepard Evans from our Board of Education, our President of the Board of Education, here with us as well. So welcome to you, Ms. Evans. So let me just start off by turning this to the woman who requested this meeting, and that is Councilmember Navarro, and then I'll jump in for some remarks and we can jump right into it.
Thank you so much, Mr. Chairman. I'm so excited that we are here with this extraordinary panel, if you will, all these amazing leaders that have a say in how we move forward on this super important issue that I know you and I have been discussing for many, many years. We've had quite a number of HHS and education joint sessions throughout the years to find a way forward. And some progress has been made, but it is important to recognize where we are right now. I mean, we're obviously, facing this challenge of expanding capacity with our existing and finite resources, because we have to meet the needs of our vastly changed county. Just very recently, I read a report in Bethesda Magazine, it was in October, where it stated that MCPS has about a third of all students now qualifying for free or discounted meals, and that student participation in English speakers for other languages, ESOL programs, has risen more than 11 percentage points since 1998 to 99, now to 17.5%. Also, the same report talked about how in 20 years, the population of MCPS has changed. So now you can see that is 31.1% Hispanic or Latino, up from 13.9%, 27.7% white students down from 51.9%, and 21.6% are Black or African American students, up from 21%. We just had an amazing conversation and a decision that we made about South Lake Elementary School. That particular school, as an example, is 98% children of color, 71% Latino. So it is clear that we have to figure out a way to serve our residents and make sure that whatever we do is culturally appropriate, because if not, we're not going to be able to achieve the results that we want. We need to also recognize that the demographics of Montgomery County as a whole also mirrors the trajectory of the school system, right? I like to remind people all the time that of the 5 councilmanic districts, only one district, District 1, is majority white. All the other districts, the other 4 are majority people of color. And so I think there are so many different policy decisions that we make that are really critical. And COVID-19 has also brought that front and center for us. We continue to have conversations like one we just had in my committee, the GO committee, about MC311, where we're saying that we're struggling to meet the simple needs of our constituents. And even though this council has appropriated millions of dollars to meet those needs, we still are referring to the majority of the people in the county as hard to reach. And so this is really, in my opinion, a much larger issue that we have to face. I think it goes to the heart of our identity as the county, and therefore our actions need to follow that. And this provision of mental health services, not having the appropriate number of culturally proficient mental health professionals, finding ways to be nimble, flexible, innovative in how we build that pipeline is absolutely necessary. And so I'm thrilled that we have our partners like Montgomery College, USG, and CPS, because I believe that we can do this. I think we can craft a strategic plan that is short-term, mid-term, and long-term. And I think we can grow our own. We have to. This pandemic is leaving some long-lasting mental health challenges in our young people and just in our population as a whole. And so to me, it's now more urgent than ever that we move forward with some kind of specific strategy. So I'm thrilled to be having this conversation. I'm so glad also that we have Dr. Santiago now in our midst to help us through, get to this place. And I thank all of you for all the work that you've done up until now to provide the necessary support for our community at a time that continues to be of great challenge for all. So thank you, and really look forward to the conversation. Thank you so much, Mr. Chairman.
Well, thank you very much, Councilmember Navarro, and I'm going to turn to Councilmember Alvarez in just one second, but I just wanted to pick up on something that you said very quickly, because I want to remind us that here today, while we are going to have this discussion, and it's incredibly important, I think that it is important for us, and staff has this listed in the packet, that we do a follow-up to this, because this is going to be a continual need, and we're going to have to continue to check in and see how progress is being done. So certainly having a meeting that reviews the specific recommendations that are follow-ups to this one, and then addressing the needs and the roles of the communities and the nonprofit partners that can also play a part in this as well. So Councilmember Navarro, I think this is something that's going to become a much larger thing. So that's great in terms of having additional meetings to continue to discuss this and make sure that we get it right. I will just build on what you said very quickly about the piece about why this is so important. And we actually have a trifecta that's upon us. As I talked to my daughter yesterday, she's terrified about what's going to happen with the transition of power. And so we have that on top of COVID, on top of racial unrest in our country. And you say to yourself, where does that leave us when it comes to really being able to ensure that a person who doesn't even suffer from mental illness, how do they cope with something like this, right? So I'm not talking about even a person who's diagnosed with some sort of condition that makes it even harder to process something like this. And you say to yourself, that's where, and we all are struggling with that, right? All of us. And so that's why this is so important. And it's interesting. I don't know how many folks are fans of This Is Us, but I will just say that it's very interesting that we're having this conversation today. And it was Randall who decided that he needed to have a person of color be his therapist, his mental health therapist, and how it was a big deal. And he was going through the whole processing of why it was important in his whole life and all the things that he had done to assimilate himself with white culture. And that was a part of what was the challenge in him addressing some of the issues that he was struggling with. And so, while it's TV, it's also real, right? Because it oftentimes reflects what's happening in our community. So with that, Chair Albornoz.
Thank you. I'll be brief so we can get to the panel, but this is a public health emergency, bottom line, and the response needs to reflect the seriousness of what all of us on this call and in the community are feeling and know to be true. We're going to be writing for generations about the impact on our children and youth, in particular, our minority children and youth through this pandemic and their families as well. And so we've been talking about this a long time, as Councilmember Navarro said. There have been many impressive efforts that have taken place, many impressive programs that have been taken place, but we need a strategic plan. And every single person on this call, and probably more that are not on it, need to be part of it. It does need to have a short and medium and long-term application. We need a lead. That lead is probably HHS to help facilitate and discuss, but every single person here has a role to play, as we all acknowledge. And we need to stop talking about this and actually implement definitive action plans with programs that have a long view in helping to address the needs of our community, because those needs, as we heard and know, are growing profoundly by the second. And so for all the reasons that have been stated, this is an urgent session that will require a follow-up, and that follow-up will need to include a specific white paper with who's doing what, when, where, and by when. And I think the executive branch is probably in the best position to help facilitate this. And I feel blessed that we have Dr. Crowell at the helm of HHS, who is uniquely positioned as a leader and understands this space better than almost anyone. And I'm also excited with Dr. Santiago being on board and his ability to coalition build, which is why he was brought on board, to carry forward the great work that's already been done, that will need to be extended. No agency here is going to be able to do this by itself. Everybody's going to need support and help. So look forward to this discussion and then the multiple sessions we're going to have on this until we get to a definitive game plan. Thank you.
Well, here. Let me turn to the woman who is ably equipped to lead us through this discussion, and that is one of my former office staff members who now is doing a great job in staffing education and culture, and that is Ms. Rodriguez Hernandez. So I will turn it over to you to walk us through.
Thank you so much, and good afternoon, everyone. I know we have a lot of participants with us today, so thank you all for joining for this important discussion. For this meeting, we would like all of our participants to go straight through your presentations and I believe council members will ask questions at the end. So we will start with HHS, the Welcome Back Center, OHR, MCPS, Montgomery College, and USG. And I have everyone's PowerPoint presentation, so I'm happy to share from my computer if that's easiest for everyone. If you feel like you want control, just let me know, and you do have access to share, but if not, I'll just share my screen automatically. In terms of the packet, I just wanted to point to 2 additional sections. Section A talks about the background on the mental health workforce shortages across the nation, not only just in diversity and language capacity, but in general. This problem is unfortunately not unique to Montgomery County. And so as we work on addressing these issues, there are a lot of other states and local jurisdictions working on them as well. The second section is on section C, which is jurisdictional practices. We won't cover them in depth today as we really want to go through the presentations and hear from our stakeholders, but they will help inform the discussions on current strategies and on our next steps that we will definitely host meetings on and create a strategic plan around. So I just wanted to inform the council members of that. And to get started, I will share HHS's presentation. Thank you.
So I can get this back down. Well, I'm going to go ahead and jump in and assume that it's on me to start talking with you all and just say good afternoon to everyone. And just a couple of things to count to the comments about from the council members. This body feels more like a symposium than a council work session, given the numbers and the stature of the people who are presenting. That I'm honored to have a chance to be here. To make this short, I'll be starting out and then turning it over to Susan Sealing, my chief for Office of Human Resources, and then for Human Resources in the department, and then to Dr. Santiago to take us into a look towards the future and things that we think we want to take a look at and partner with it going forward. To begin with, a couple of things for me on context. My goal obviously is building capacity in health and human services and programs to ensure that we can meet the diverse needs of the county. But beyond that, it is also building not just in the department, but across the county in the provider network and community, that same capacity and resource to be able to meet the needs of the current and the future needs of the county. As a Black male psychologist and a therapist for many years, I can tell you that the number of people who come to my door, and to your point, Council Member Rice, because they want to have a therapist, a Black therapist, and in my case, a Black male therapist to talk about their lives and their work, and to address some of the issues that they carry around with them, implicit bias and unconscious racism that plagues everyone in this country. I want to set a context for this a little bit, and the context around this is that cultural diversity, and if you could skip to slide 5, I guess it is the 5th slide in this, that would be helpful for folks. So you can see this. The psychology is a pet peeve of mine. I'm a clinical psychologist, and so I'm always wondering what's going on in the clinical psychology space. So 2 things on this. One is that the psychology workforce, as you can see, is largely white and largely male still, surprisingly so, given the staffing ratios we see in Montgomery County and in HHS. The number of psychologists who are in service, in health services, even lower than the total number that are across all of the country, that are trained across all of the country. There is some good news when you look at early career psychologists and psychologist doctorate degrees that are awarded. You see the numbers beginning to climb. So the numbers are going up, but it is not quite where it needs to be at this point. Next slide, please. As an aside, well, I will say that when we look at social work, the numbers are slightly better. Obviously, when you look at the numbers of Black or African American social workers who have either a bachelor's degree in social work or a master's degree in social work, the numbers are better than they are for mental health. for psychologists, but still not where they need to be. And the piece that isn't here, we don't have a slide for, but I will share with you is that when you look at psychiatry, there was a study published in October that indicated that 10.4% of practicing psychiatrists in the country are Black, Brown, or Native American. So you get a sense of just how scarce the resource is across the country. I would also say to you that the graduate education is costly. My niece finished her undergraduate degree with a $90,000 student loan debt, which is just stunning. The cost of getting a doctorate degree in psychology as of 2 years ago was in excess of $150,000 above whatever you spend for an undergraduate degree. I have to tell you that if that were the case, when I was coming through graduate school, we would not be having this conversation. You'd be having it with someone else, but it wouldn't be me. Could not possibly have afforded that, me or my parents. And the other thing I would say to you is that the competition for talent in behavioral health is huge, and it includes competing with private sector. With that kind of cost for graduate education, the salaries that we're able to pay in the county, the salaries that public service sectors are able to pay, it makes it hard for folks to want to be able to stay in the public service and do public service. So I think that those are just a couple of things that I wanted to make sure I share with you at the start of this. I think that I'll end it this way. I think behavioral health has always been an emergency in this county since the late 80s. And the deinstitutionalization movement and gradually stripping of behavioral health services from funding streams, and as of course COVID has made this an imperative now, and obviously demonstrated the problems. COVID we should be thinking of as a long-term disaster. The mental health issues that follow, that are being developed now in the midst of COVID, are going to be with us long past the state of emergency is gone. And long past long past our last test and our last vaccine, we're still going to be dealing with the mental health issues. So it means that we do have to begin now to think about how we plan for and move ahead. There is some good news across the county for us. DHS, HHS, and OHR have been working together for several years to both expand our recruitment options and to review our workforce needs, and doing more to promote retention in the county workforce. I think we have to do more. We have to do a lot more, both in promoting interest in this field, both at college level and in high school, so that we have folks who are contemplating their next moves to consider coming into health and behavioral health care fields. We have to do some work with our partners that are in this room today, creating academic and training partnerships and opportunities to move people into the field and to help them get through the academic training that's necessary. Within the department, I think we have to create some career ladders that allow people access to progressively more responsible and progressively more professional positions. And then I think along the way, we also have to re-examine our requirements for positions, for the work that we do. Not everything that we do and need to do in the world of mental health requires a mental health, a master's in social work or PhD in psychology. There are many roles that can be filled, at least initially, with alternative career tracks. To that end, I want to say this about this, and I want to turn this over to Susan to take us forward and look at where we are in the county, in the department. But that often when people talk about mental health, they talk about social work. And when they talk about funding positions in the county, they talk about social work. But there are a lot of different positions, career paths, other than social work degrees that lead us that lead to careers in mental health in the department. And I think that Susan will start with that, I think, and we'll see. You'll get a sense of what I'm talking about, as well as a sense of the fact that that there is some diversity in the department, and that diversity has grown in the department, but there is still space for more. So with that, I'll turn it over to you, Susan.
Great. Thank you so much. And if we can just move forward to the next screen. So as the director said, one of the challenges is the lack of diversity within the pipeline, which represents our ability to hire into our classifications that support our behavioral health efforts. But one of the things to build on what Dr. Krause said is the associations and universities and colleges are incredibly aware of the issues related to diversity in these particular fields. And there are a tremendous amount of efforts in both professional association, like the National Association of Social Workers, the medical associations, which supports the psychiatrists and those kinds of classifications and professions that are really focusing on building that pipeline that really does start at the bachelor's level. So I think that is a piece of good news, but that is an effort that is going to take time and is going to really take years to come to fruition. But with that said, I want to walk us through some data that looks at the department's workforce. We've got throughout the department, we have just shy of 500 employees that we would classify in a behavioral health response classification. A large majority of those positions obviously sit in our behavioral health and crisis services division. And we look at these classifications really in two perspectives. We have a group of positions and individuals that are in classifications which require some sort of licensure. Those are therapists, supervisory therapists, psychologists. And then we also have a group of positions that are part of our mental health response that do not require a licensure. And those are our behavioral health associate counselors, client assistance specialists, community services aides. And we really see that those kind of bifurcations of classifications as an opportunity to create the career ladder that Dr. Krause talked about. So I'll talk about that a little bit later. But again, just wanting to see the breakdown of the positions that we have in the department. The majority of our behavioral health positions within the behavioral health division are obviously our therapists. Many of those therapists are social workers by education, but they are in roles that provide that face-to-face client service within the department. So if we can move on to the next slide. One of the things that we wanted to look at is the race and ethnicity breakdown. And this slide shows a comparison of the race and ethnicity breakdown of both our licensed classifications as well as our non-licensed classification. And as Dr. Krause said, there is a challenge with diversity within the pipeline profession, but even given those challenges, we have a level of diversity that is driven into our workforce. But we still have a lot of work to do. As you can see on the slide, group 2 denotes our supervisory therapists, psychiatrists, psychiatric nurses. The largest grouping within that set of classifications is white. And if you go back to the initial slide that we looked at, the majority of the professionals coming in through the pipeline are in fact white. So again, as we look at work to diversify the profession, we hope to see that these numbers begin to look different as well, because one, the pipeline becomes more diverse. Our work to entice mental health professionals to not only contribute to public service, but do that work in Montgomery County, those efforts are going to have to work in tandem. So again, we do have and enjoy some diversity within our behavioral health workforce, but we also have work to do in this area for certain. So if we can move on to the next slide. This slide represents the bilingual staff that we have throughout the department. This is in both behavioral health and non-behavioral health positions. You can see the large portion of our bilingual staff are Spanish speakers. And just for clarification, the advanced notation is for both translation and interpretation, and the basic is for interpretation. So again, this represents the bilingual staff that we have in the department. And again, if we move on to the next slide, just simply shows the representation kind of graphically of the distribution of bilingual employees that we have in the department. And then the next breakdown shows, again, by those classifications that we had talked about that are specific to behavioral health within the Behavioral Health and Crisis Services Division. This is the breakdown of bilingual staff by classification. And just to put a finer point on this, this is staff who are certified through the county's program to receive pay differential for bilingual classification. This is not representative of all staff that we have that are bilingual, but this is the staff that are recognized in positions that we have recruited for and asked for bilingual staff. So I just want to make that distinction. And the last kind of piece of data that for benchmark and comparison, you can see that this shows county residents, living in poverty, residents without insurance, and then we begin to look at the breakdown of health and human services clients. This is for the fiscal year that just ended on June 30th. A further breakdown of behavioral health clients, and then the allocation of staff as it relates to the clients we serve. So using this particular high-level data as a benchmark, again, I think our staff, we do enjoy and see diversity within the behavioral health staff. But as we look at that against the county residents, as well as the clients that we serve, not only in the department, but within behavioral health and crisis services, again, we have some opportunity to continue to work in further ensuring that our staff within the department is a greater reflection of not just the clients that we serve, but also the residents of the county. So I think this is good representation there. I think we'll move past this in the efforts of time, and just if we can move on to the next slide, talk about some of the things that we are doing. And again, as Dr. Krause said, we are working very closely with the Office of Human Resources to secure a more diverse pool of applicants, because that's really where we need to start. So we are working to kind of further expand the visibility of our department vacancies. We are really working proactively to recruit behavioral health and other clinical vacancies. We're partnering with area universities to cultivate potential candidates. We're using our current employees as referral sources for these vacancies, and really building on our internships to create recruitment pipelines. So if we can move to the next slide. Again, Dr. Krause talked about career ladders. One of the things that we've talked kind of very tangentially, but need to continue a conversation with the Office of Human Resources. It's really looking at the classifications that are offered. Are we creating career ladders for early career professionals to remain with the county but move up in the county? Review and revise the qualifications so that it gives folks an opportunity to come in at an entry level, but as they advance, get more experience and potential education, they can move through the department and again choose to stay with the county versus having to leave for additional opportunities. Establish entry-level positions that can be recruited from the county. We don't have a lot of entry-level positions within the department that are focused on providing those peer kinds of opportunities. And then the last thing here around the career ladder is focusing on supporting staff who are trying to secure a clinical degree while they're working with us, and what kinds of things can we do within the department to support the need for them to get clinical hours and those requirements without having to leave the department or the county to secure those kinds of opportunities. And then I think the last slide really speaks to some of the work that we're doing around professional development. We have a program that provides continuing education credits for our licensed staff. It's free of charge and allows our staff to get their required continuing education units to maintain their licensure, and they can participate in that training. We are exploring the development of a mentor program for those newly hired clinical staff that are coming in, and I think connecting those individuals with seasoned employees will really, I think it's a win-win. It helps the new employee really engage into the workforce, but I think it also challenges some of our more seasoned clinical staff as well. And then the last thing here I will speak to is continuing to support and develop the work of the Welcome Back Center and creating pathways for foreign trained professionals as, again, another kind of opportunity that fills both kind of a number of needs for us. So on that note, I will hand the conversation off to Dr. Santiago.
Thank you, Susan. I want to start with a little story. So back in the 1960s and 70s, the government of Puerto Rico was in a very dire need of qualified supervisory workers, social workers. That was the era of the federal war on poverty, if you recall. And Puerto Rico had its own war on severe poverty that had built up for decades, if not centuries. So the war on poverty really benefited Puerto Rico at that time. So my father had been working as a social work technician for a number of years towards the late 60s, and then in the early 70s, the government of Puerto Rico, like I mentioned, was in dire need of these supervisory social workers. And so they offered my father three things: paid tuition to get his master's degree. They gave him time off work for 1 year, and they paid his salary as well. And he got his master's degree in a couple of years. And he was not the only one. He was with a team and many other technicians who availed themselves of that opportunity. I think that specific activity is something that was specific to that situation. However, as we think about Montgomery County and the target populations, and as Susan said, how do we get professionals in the behavioral health area to come from the communities of color that continue to increase in our county and diversify our county, which is a rich resource that we do have here. I just want to underline 3 points that Susan made, and then I'll pass it on to Carmen Saez, who's going to give some thoughts about the activities of the great Welcome Back Center. But let me say 3 points. One, this is looking into the future, into what our strategies should likely be. And like I said, Susan has pointed out to them already. But one of them, well, the three areas are recruitment, mentoring, and incentives. So in recruitment, I want to underline what Susan said. We need to continue and maybe accelerate our partnerships with the higher education institutions, many of which are represented here in this meeting itself, and especially working on internships and getting people in the door. The second thing is mentoring. I do believe, especially for the workforce within our county government, that we may want to consider half-time or maybe a full-time mentoring role in HR for those who are trying to go up the ladder and really beef up, especially at the higher levels of our professional workforce, and also work at professional development and retention of the folk that are coming in the pipeline, just creating a robust pathway for them. But I think that it requires really intentional mentoring, in that we just don't pass them from one department to the other, but that we continue to nurture them, cultivate them, look at what their needs for licensure might be, or professional development and so forth. And then finally, the incentives. And I started with my story about my father. How do we incentivize? How do we look at at the debt. Dr. Kroll mentioned that's a factor for psychiatrists, for psychologists, even for social workers, especially at the higher levels. How do we deal with that? What kinds of incentives can we provide? Can we be as bold as saying they can have, time off and pay them, to go and spend a year getting their master's or their doctorates or what have you? So I'll stop there and pass it on to Carmen, who's done incredible work with a Welcome Back Center, and she has several success stories to talk about. I think you're, yeah.
Science, you are muted. There you go.
Okay. Good afternoon. I am Carmen Sainz, and I am the manager of the Welcome Back Center, a program of the Latino Health Initiative. Before I start sharing this overview of the center about the workforce focusing on behavioral health pathways, I want to briefly mention very, very quickly about our beginning. And I know many of you know very well the Latino Health, the blueprint for Latino health in Montgomery County that in 2002, the very young Latino Health Initiative started. There is one priority identified that early, which was increase the number of bilingual and bicultural health professionals in our county. And in our third edition of the blueprint from 2017-2026, that still remains there. We have worked intensively for over 10 years with nurses. We have a very successful program helping internationally trained professionals, individuals from our community and from our county who are living here, so that they can transition into the health workforce back in their dream career that they love so much. Again, I myself am internationally trained. I am not in the health field. I'm an industrial engineer. And when I came here 30 years ago, I thought I had all the options open there, but guess what? I have only been a county employee for 2 years. Formerly 15 years as a contractor with the county, and I myself have experienced that close mentoring and working with Sonia Mora for these last 15 years. But as Dr. Santiago mentioned, and I'm going to share the experience of the Welcome Back Center, we really need to put much more in this. So let me tell you about the workforce, the work we have been doing focusing with behavioral health careers pathway. And Dr. Crowell has been with us opening the doors from the very beginning to open this option for us in the county, where we invited our local behavioral health providers from the nonprofit organizations to work with us. And this is the model of behavioral health services that we have. This is built upon the experience that we had with the nurses. It includes the same components, but these are customized for career navigation in the behavioral health field. There was a lot of interest about the credentialing evaluation. Here's where we do that. We assist the clients, the participants, the internationally trained professionals to get their credentials evaluation here, and we work with the boards locally to help in that process. The other critical component is English as a second language. We had English Health Train developed within our national network. We belong as a Welcome Back Center to the Welcome Back Initiative, national organization where this curriculum was developed, which is English contextualized in the health field that really helps accelerate the process of learning the language. And the stepping stone employment. This is the career pathway that have been already mentioned. And we will like to much more intentionally build more, but I'm going to share you the experience we have had so far. These are from different levels, entry to mid-level. About the people that we have worked with, 34 participants were recruited for this program, 24 of them with actual behavioral health fields, 23 of them Spanish speakers with mostly psychology bachelor's degree back home, one Amharic Tigrinya speaker. 6 physicians interested in exploring these behavioral health career pathways, 2 Spanish speaker, 1 Spanish English, 2 Amharic and 1 English speaker, and 4 nurses, also interested in exploring these career pathways, 1 Spanish speaker, 2 Amharic, and 1 French speaker. The credential results, credentials evaluation. From this group of 34 individuals, 18 of them completed the credential evaluations, which provide to them an equivalency of their degree abroad to the United States. And what we've learned from those reports is that those degrees in Latin America of 4.5 to 5 years of education are comparable to a bachelor's degree in psychology in the United States. Next. Now I'm going to mention 2 very, very critical elements to be successful. We are many people in this discussion because it requires that many people. It requires many different individuals. But there are 2 main groups, the employer partners. We have worked, as I mentioned before we launched this, we had a meeting where Dr. Crowell helped us bring to us all the behavioral health providers, and we sat down at the table, talked with them, started this process, and they have been committed and continue committed working with us. To those efforts, we placed 16 of 30 individuals from this group who secure entry and mid-level positions in the behavioral health field. The other important area is the work with the boards. There are 3 main boards here in Maryland with which we have talked. 2 of them were already mentioned, the Board of Social Work Examiners and the Board of Examiners of Psychology. But there is an additional board, the Maryland Board of Professional Counselors and Therapists, for the individuals we have worked at the bachelor's level and the ability to move with less support than Dr. Santiago's father, which would be ideal if we get that type of support, but very, very few have been able to really move farther from entry level and mid-level. However, through these efforts, we are much more aware of what these challenges are and what it may take to a bachelor's degree in psychology to transition. Oops, I think we lost the presentation. Nicole, I'm sorry, if you can help us to get it back. Thank you, Nicole. So, as I said, so we have learned about those challenges and we have walked part of the road so far to get to that final journey to become counselors and therapists that could be supervisors, that they could work independently. Next one, please. So I'm going to illustrate with 3 examples of partner employers that have helped with securing entry and mid-level. I start with the Maryland Treatment Center because this partnership was really critical. Even though it's a smaller employer from all the ones that were involved, Maryland Treatment Center really we were all concerned about the lack of opportunities for the bachelor's degree to really advance. But the executive director said that she thought the alcohol and drug trainee certificate could be an option. We have 1 participant who embarked on that, and she started that process. She has been with Maryland Treatment Centers for 3 years. They have really made this intentional nurturing, mentoring, working with the individual to help transition. And this person is currently working towards the associate counselor in alcohol and drug, which has required additional education. She has been taking classes with the Baltimore City Community College, and she's advancing in that career. This other example is in our own department, and this is a participant who started with us at an entry-level position with family services, and she advanced in her path. But now she is a community service A3, and she is studying a master's towards the professional clinical counselor license. She finished the first 2 years of her degree. She's a counselor in psychology, currently doing a scholar internship. And this is one example of the person we could do the road and help to build these career pathways that we are talking about, doing partnerships with our academic institutions and trying to figure out ways to help them. Could you go back, please? There was one more that I wanted to mention. Family services, they were able to hire 5 of our psychologists internationally trained. It was a lot of networking, peer support among them to inform about the vacancies that were going on, and that was a great success story. You can read more about this in the written report that we provided. Next one, Nicole, please. Finally, what are the possible strategies? This has been mentioned already. For the internationally trained professionals, there has been, additional barriers that somebody who study here. So creating these entry and mid-level positions for offering a career pathway will be critical. This intentional and intense commitment from employers, including the different players to navigate and overcome the challenges, will be important. This includes not only the Department of Employer, but also the academic institutions, the boards, and helping with different internship requirements. The tailoring and coaching is very critical because each individual has very unique circumstances, and depending on their educational background, their work experience, and personal circumstances, the needs may vary, and that would be very important to be very attentive to that. Giving flexibility in the work schedule, this 1 year that you mentioned, Dr. Santiago, 1 year might sound a lot, but the truth is that if those situations are not provided, it's going to be very difficult that people could do these type of things, and we'll see how much we can do on that end. So offering target tuition will be very important. So thank you. This is the points that we wanted to present today.
Well, thank you very much, Ms. Hyens, and thank you very much to DHHS as a whole. You provided us some great information. I just wanted to do a time check, and for my colleagues, there is some background chatter in terms of our 4 o'clock meeting, so make sure you're paying attention to your cell phones. There may be some updates as to our 4 o'clock meeting, but let me quickly go ahead, and I think at this point, Nicole, we're going to turn to Mr. Attila of our OHR. Is that correct?
Yes, that is correct. And thank you to our stakeholders. Again, just want to remind that 4 p.m. stop time. So if we want to focus on strategies and future efforts, that would be great. Thank you. I believe you're muted, Mr. Attila.
We still can't hear you.
The time crunch.
Oh, there we go.
We can hear you now.
You can hear me now, right? Okay. So what I was saying, I'm a victim of my own mute bingo. So that's checked. And then the other one is we were anticipating that the back-to-back presentations may take up a lot of time. And we work with HHS and then build our strategy and then data information to HHS presentation already. So what you have heard throughout already includes our position. And then we do not have an additional presentation that would take up time. But I would like to do is I would like to make myself available to answer any of the questions you may have that relates to our strategy and the work we're doing with HHS.
So I appreciate that. So what I'd like to do is continue on then with our presentations, and then we'll get to those questions because I know my colleagues have questions and I really want to get to that in discussion. So I appreciate that, Mr. Attila. So go ahead, Nicole. Who do we have next? It's MCPS, I assume?
Yes, we have MCPS.
Excellent. Dr. Smith, Dr. McKnight, the floor is yours.
I think Ms. Evans, our board president, is going to lead off with remarks, and then Dr. McKnight and I will just have a few comments about the slides we've provided.
President Evans.
Absolutely. So thank you and good afternoon to everybody. It's always a pleasure to be here with you. So in the report, in the presentation that you will receive today, you'll get information on our mental health professional workforce and our efforts to increase workforce diversity as well as cultural competency in our mental health professional staff. And with that, I just want to just talk briefly about the numbers. We have over 600 mental health professionals in our school system, and they consist of school psychologists, social workers, school counselors, and they work really hard to make certain that they provide supports to our students and their families. And that work is also shared with our personnel workers, as well as our parent community coordinators. You know, I am just really proud to be a part of the board and work with MCPS, because MCPS recognizes the value of a diverse workforce and a culturally competent workforce as well. They know that it will benefit our students, in particular in areas of social and health issues. So I just wanted to also recognize that we know that there is a challenge with trying to encourage our students to, you know, move into this career pathway, as well as recruiting, you know, appropriately credentialed professionals outside of the scope of MCPS. But, you know, equity is always our work and it's our goal. And with this goal, we will continue to strive to make certain that we are hiring a diverse staff in our school system that will continuously benefit our students. And then you'll hear in the presentation about our career planning pathway for our students, as well as our work with Montgomery College and other colleges in the area. And then also, if I want to just talk a little bit briefly about our Office of Human Resources and Development, they are doing some phenomenal work. Here lately, they have an initiative where they're trying to work to increase the diversity of our workforce and to retain the people that we're hiring. So you will hear that too. And so I'm going to turn it over to Dr. Smith and Dr. McKnight. They will continue to share with you the work that we're doing around mental health professionals. And I just really appreciate you all. You're always so invested in our school system, and you care very deeply about our the mental health of our students. So I really appreciate that, and just looking forward to having this discussion with you all. Thank you.
Thank you, Ms. Evans. I would like to add my voice to that appreciation for the real focus and attention paid to the education of every child in this community. And certainly the elected officials here in our county are a very, very big part of that focus and that support that we all believe is so critical to the health and well-being of the entire community. Today, we're going to talk about school-based mental health professionals, give you an overview of how many and who they are, as well as their qualifications and the salary ranges. It is important to remember that most of the positions in our school system are not only governed by the professional organizations that our health department colleagues mentioned, but also by the Maryland State Department of Education certification rules. And that doesn't add an additional complication in terms of who can be hired and what they have to have done educationally and through certification. Also, we're going to talk about career pathways and programs and how we support careers in mental health in the school system for students and for our staff. And finally, we'll briefly talk about some very real opportunities, because I think Councilmember Navarro is spot on when she talks about the possibility of really developing and growing our own professionals in this county when you consider that we have 1 million residents. And those opportunities are there, and we'll talk about those at the end, and then we'll complete our presentation. So Dr. McKnight, if you want to walk us through some numbers, and then I'll come back at the end.
Yes. Thank you, Dr. Smith, and good afternoon to our county council members. Our goal is to be able to get through this presentation within the next 5 to 7 minutes so that we can afford some time for discussion. And so I am going to give a high-level overview, and Ms. Rodriguez-Hernandez will probably take our slides within threes at one time. So I'll quickly start with the area that Dr. Smith mentioned around who is it that we have in our school buildings and within our system to support the mental health needs of our students and our community overall. And I will just quickly go to our the 3 slides. The first one focusing on school counselors. And our school counselors positions are positions that are essentially based on student enrollment. So the number of students we have dictate the number of school-based counselors we have. In addition to school-based counselors, we also have ESOL counselors who all speak Spanish and are assigned, and I must say, 8 of our ESOL counselors are assigned to 14 of our high schools with the highest Spanish-speaking population. So we're being very particular and specific about how we allocate our resources and where. Next, our social workers, they're assigned to our special programs like our alternative programs, Head Start programs, special education services programs, including social emotional programs within special education services. So they're another support. Next, our people personnel workers are also a support to mental health within our system, but they are not credentialed mental health professionals. However, they are very critical in how we coordinate services to our students and to our community. So that overall give you a sense of who the staff are that we utilize to support these needs within our school system. The next 3 slides are really just going to highlight a few things for you, which are our demographics and how that pairs up with our students compared to the mental health support staff members that we have. So yes, we definitely emphasize the importance of diversity in the workforce is important. As Councilmember Navarro said, our system is who we are, who we have been, and we've grown to be even more diverse, and we celebrate and acknowledge that. In acknowledging that, we have to also look at, and as we hire staff, how does that measure up with, or how does it balance out with our student population? So if you look at the slide, the one thing I'll note to you is that our Black and African American students and school counselors is a category that stands out, but all of the others are categories in which the students and the professionals are not particularly aligned. So we are paying attention to that as a particular area of focus that I'll talk about in just a minute in terms of how we're focusing specifically on that. Next slide, please. So also for our bilingual mental health professionals, we also very much think about the importance of focusing on bilingual mental health professionals. To date, we have 34 school psychologists and 88 school counselors, including our ESOL counselors, who report as being bilingual. Primarily, you see a number of languages here that represent our community and the languages represented in our community. So that continues to be a focus as we hire staff and onboard them and encourage them to become bilingual to support the profession. The next slide really highlights overall a dynamic that's important in all of this, and that's the conversation of how salary and the credentials that are required plays into this. So they are important. Earlier, I know Dr. Crowell mentioned about credentials and how that plays a part. Later in some of our challenges, Dr. Smith will emphasize some of how that plays into us as a school system and requirements by the Maryland State Department of Education. All MCPS credentialed mental health professional positions require an advanced degree in the appropriate field as a minimum state-approved certification. So that's something we are acutely aware of and have to pay attention to and think about how that plays into our staffing and what we're able to do. Next slide, please. So I am going to just quickly highlight for you a few things that you're aware of. Next slide. One thing I'll point out in our career path for mental health professionals is that we have to pay attention to this. I'll give you one example. A school psychologist must be degreed and then also credentialed in school psychology, not another field of psychology. And so when we think about an example like that, we have to consider the timeline that it takes for people to meet the state-approved credentials for entry-level requirement into some of these positions. Again, we'll talk more about that when we speak about challenges. Next slide. I am going to quickly go through some of these things. Our Human Resources Office did a phenomenal presentation the other day with our Board of Education, talking about the importance of reimagining human resources. The impetus of that was all about how do we utilize our resources to elevate our priorities as a system. You'll see here a number of platforms and things that are listed that we have done within our human resources offices to make sure we're doing outreach, really reaching out to universities and colleges and having those virtual information sessions, even during the pandemic, to make sure we're staying above and ahead of communicating with those future employees. Next slide. So next, again, earlier we talked about the importance of growing our own and having graduate internships. So this is the opportunity that we seize on and always consider how and who are the people out there who have an interest, and how do we build a relationship with them before we try to recruit them as professionals in our system to support the work. That's where our interns come in and are really important to that. And for our MCPS school psychologists, they actually provide clinical supervision to graduate students throughout the practicum and intern experience and we monitor and build that relationship, really trying to make them the workforce that we have secured in our mental health professional support system in MCPS in the future. Next. So this is the one thing I will lean in before we close out with our challenges. And I will again tie this back to our Board of Education, who constantly looks at how they elevate and we elevate the equity policy within our system. And the other night, they supported the system's request to have an anti-racist audit that gets at the heart of this very thing that you see here. And so there are 3 areas that I'm going to focus on, and we can talk another time about that audit. But that audit calls out 3 areas that will address the importance of recruiting a bilingual profession and a diverse profession beyond just recruiting. And that focuses on our workforce diversity and having us have an objective lens at who is it that we're hiring and how are we preparing to create the conditions for them to want to remain and stay in MCPS for years to come, up until retirement. That's our goal. So one area is workforce development that's in that anti-racist audit, but the second is work conditions, because it ties to what I just said. How do we evaluate the working conditions of our staff to ensure that in all of our schools and all of our office spaces, people feel connected to the organization, feel honored in the diversity that they bring and want to stay? And the third is evaluation of school culture. That's about students and staff, because it also gets to the heart of how do our school cultures represent how we create the environment in all the spaces in MCPS. Without apology, that is one that is built on acceptance, celebration of diversity, and most importantly, dedication to our students. Every single one of them, regardless of race, status, socioeconomic status, all of those things. And so the audit really is an opportunity for us to elevate those pieces. So that I wanted to highlight to you. Dr. Smith is going to take us quickly into the challenges around, well, actually a celebration around dual enrollment. We could not do this without our Montgomery College USG partners who have been with us with identifying who the students are right now, who we ultimately want to get certification and coming back as employees. So Dr. Smith will speak quickly about that and the challenges around the pathways of securing those professionals through requirements and certifications. I'll turn it over to you, Dr. Smith. Dr. Smith, you're on mute.
Thank you. Sorry. The word of 2020, the words, you're on mute. So our dual enrollment programs show real promise with Montgomery County, and this is an area where we can expand. We have very strong Academy of Medical and Health Professions, but they do not start in high school. And we're going to look at how we can begin developing interest in students who want to pursue a medical career around the mental health professions as part of those academies of medicine and health professions that we already have. If you look right now, in 2018, we had 8 students who completed an Associate of Arts degree and a high school diploma on the same week in June of 2018. In 2019, we had 14 students who completed those 2 accomplishments in the same week in June. In 2020, after 3 months of pandemic, we had 40 students who completed Associate of Arts degree and high school diplomas in the same week. And we expect by 2023 to have over 1,100 students who will complete an Associate of Arts degree at Montgomery College and a high school diploma in the same week. This is where we can grow our own and develop the interest in these professions at the high school and community college level, and then use USG as the very next logical step for students who want and need to go there. We also can develop more healthcare profession capstone and internship programs at the high school level. We've vastly increased these types of internships. And we also have the issue of early college degree programs and 4-year degree programs at Shady Grove, and working with Shady Grove to make sure that those are in place. These are all things that we as a school system can do, working with our partners in the community. What we would do is then turn to the Montgomery County Health and Human Services Department and other areas of the community to help us develop those internships and those capstone experiences as students go through high school and walk into the Montgomery College experience or go somewhere else with that Associate of Arts, because they can walk into any campus in Maryland with an Associate of Arts from Montgomery College. They're automatically admitted. So we'll build that out. The second issue is the degree programs, enrollment and completion, and industry completion. In the state of Maryland, we must develop partnerships with our institutions of higher education and create bigger pies. Everybody wants a bigger piece of the pie. We need a bigger pie, which means many, many more students, especially students of color and students who are in poverty of all races, need to be able to get to that higher education experience successfully. And we've been doing a lot of work around that, but we need to continue to support that work across our school system and across our community. And that is incredibly important work that our anti-racist audit will help us with, that our work with equal opportunity schools, where we've profoundly increased the number of seats for IB, International Baccalaureate, Advanced Placement, and other college-going kinds of experiences during high school. And then we need to put pressure on higher ed, USG and all the USM system, the private colleges, to open those gates, because they say they want high standards. The high standards matter when you graduate much more than they do when you enter. And the entrance requirements sometimes are barriers, and the industry completion in public education also has a lot of barriers in the Maryland State Department of Education certification rules. Next slide, please. So I've talked about all of these things in career planning and second career options. We are working vigorously in our HR program to bring in people with credentials or virtually completed credentials. We're also working with our support professionals to become teachers and other licensed professionals, and we're supporting them with time, with resources, with funding, with schedules, all of those ways right now, and building that out. Next slide, please. And I just would say that we really have to push on higher education. They've simply got to recognize that getting a bigger piece of the pie in teaching, in mental health professions, in counseling, and other areas in schools and in our community, it can't just be that everybody's competing for the same small group of students. We have to enlarge that group of students, and we have to give access and opportunity to so many students that can do this and would do a great job if they got those first steps supported and got the opportunities that they deserve. So we're doing a lot of work in this area. Where do mental health professionals work in our school system and in our communities? You can see right there what they do. And the next slide, please. Thank you.
Well, thank you very much, Dr. Smith. And I do have an update for everyone. We have actually been granted some additional time. The warden has given us some additional time, so we're actually going to be going to 4:30. So I thank the council president for that. So we're going to turn to Montgomery College. Dr. Rai.
Thank you very much, Mr. Chair. Thank you for this opportunity. I want to thank all our elected leaders for having the vision and courage to talk about these important issues. And we're very fortunate to be living in an area like Montgomery County. From Montgomery College's point of view, we are always looking at community needs, directions, and certainly the labor market data. In the area of behavioral health, just over the last year or so, within 50 miles radius, we saw about 45,000 jobs. And we expect this to grow by about 16% by 2029. I'm going to invite our Dean for Health Sciences, Dr. Monique Davis, to continue this presentation and share some of the programs that we have in behavioral health area. But I will add just a couple of things to Dr. Smith's comments about early colleges. We have early colleges, we have middle colleges, and they include health sciences, nursing, including nursing, And a very important program that articulates with psychology program at UMBC psychology program at universities of Shady Grove. So Dr. Davis?
All right, so hello everyone. Thank you for your time. There is a lot of synergy and overlap within the agencies that have spoken thus far. We are excited at Montgomery College as being a bridge from getting students wherever they are to get them to their educational and their professional goals. So with that being said, we looked at our mental health program and we identified some curricular gaps, and we expanded our program to now include aspects of behavioral health. So as you've heard, mental health has been discussed, behavioral health has been discussed, and as you can see on the PowerPoint, we wanted to expand that those concepts and those experiences related to counseling, issues related to healthy behavior, so we could integrate that in our curriculum. We also have a robust nursing program where our nursing students have a 1 semester clinical experience with mental health nursing. As you know, our nursing program is one of the best in the state, which we like to say very proudly here in Montgomery County. And we're fortunate that our recent graduates had a 92.37% licensure pass rate on their first attempt. So the biggest piece within our programs at the college, and you can move forward you can move forward beyond that slide as well. We'll pause right here, but I'll just want to share that we want to make sure while students are with us at the college that we're offering them the support that they need to be successful. So it's one thing for us to market and get students into our program. We're excited about our partnerships with MCPS, with our early college program. We have several of our health science programs with nursing, radiologic technology, surgical technology, and we're expanding for our behavioral health. We're having those conversations with MCPS so that we can make those connections early while they're in high school. But we want to make sure that students have the support that they need once we get them in our program. Yes, we can market. Yes, we can get them in the program, but we want to get them through the program to program completion, graduation, employment, and then on for an advanced degree. So we have a unique partnership with the Healthcare Initiative Foundation, where our students receive scholarship funds, and those dollars transfer with them when they transition over to USG. So we're very proud of that partnership with the foundation. And also a component of the Healthcare Initiative Foundation, students have activities that they participate in, and the bilingual training is one of them, where students come in, they have some training, and then they can take a test to see if they're advanced or proficient within their language to be a translator. So within all of these touch points with the students, we want to just drive home the message of once we get them into our programs, we want to get them through the program successfully. We have mentorship programs. We have a ton of resources with our TRIO programs, with our mentorship program. So we have a slide there that talks about that. Again, as we've heard, we're going to have some follow-up meetings. So we look forward to just going into deeper detail about the resources that we have for student success through our Student Affairs Office. And then we can go to the slide there that talks about our workforce and continuing education offerings, where we're fortunate Mr. Steve Greenfield is with us. And with the Diversity Institute, we take it beyond the credits. So you have your academic affairs, credit courses where we just talked about behavioral health and nursing. We talked about some of those support services that are centered around student affairs, but then we also partner with our community agencies, governmental agencies, nonprofit entities to offer some diversity training and workshops. So I think here at the college, we're able to connect with our community very well to meet the needs of students and our community partners. So I know that our time is running short, but the last thing that I want to share is that we like to connect to get the students to their employment opportunities, but we're also very pleased about our partnership with USG. And I know USG is getting ready to share, but we love being that pipeline and being that bridge from MCPS onto employment, and then being that bridge on to advanced degrees. So we look forward to being an active stakeholder, active participant in these future conversations and creating these pipelines as we heard about making that pie even bigger. We look forward to being in the trenches there to get the work done. So thank you for having us. Dr. Wright, I'll turn it back over to you.
Thank you, Dr. Davis. So that was efforts from Montgomery College, and we are always open to new partnership, new ideas, and moving forward to address these issues. Thank you very much for this opportunity.
Thank you so much, Dr. Ryan. Thank you so much, Dr. Davis, as well. Let's turn to universities at Shady Grove. Dr. Pittman.
John, I think you're muted. Hi, everyone. I'll start because I'm not sure that there's Joan.
No, oh, I'm sorry.
That's okay. I didn't hear you for a minute.
I was just talking to myself over here. I was just saying, Nicole, Katie's going to start, but we decided not to go with the PowerPoint presentation. I know we've already seen a lot of those. It's in your packet, and we're just in the interest of time to share a few key points, and Katie was going to start with that.
Hi, everyone. Thank you so much for having us today. My name is Katie Morris, and I'm the program director for UMBC's undergraduate social work program. It's great to see so many of you. I know so many of our partners from DHHS and from Montgomery College. So great to see you. Thank you so much for your time. So I think what you're hearing, I know it was great. Monique was a great lead-in for us. Dr. Davis was a great lead-in for us. So we work closely together through the MC to USG pipeline. Again, I can't say enough, the Healthcare Initiative Foundation has been a great partner in providing scholarships and supporting that pipeline, which has been fantastic. A majority of our students, and I'll speak from social work, but UMBC also has a psychology program. So we do have a lot of our students, again, in the pipeline. A majority of our students at UMBC, 85% are coming from Montgomery College. Again, a majority of those students are arriving with an AA degree. So that's, good news in terms of the foundational work that they're getting from Montgomery College. As MC just noted, a majority of our students are arriving through the behavioral health path into social work and also through general studies. So that's exciting. You can see too, our population at Shady Grove really does match the community that way. We have 40% of our students in social work identify as Latinx, 19% Black, 19% identifying as white, and then other 16% or 2+ identities that way. So really diverse student population. I would say about 40% of our students are multilingual and 40% are first generation. I share some of these statistics because I think it's really important to understand the student population at Shady Grove. And I know this has kind of come up before. A majority of our students, again, with the first gen working students, family responsibilities at home. I think that's important for us to recognize the student population that we're looking at. So not all of our students are traditional students where they're on a path where they're able to complete a degree exactly in 4 years. It might take them a little bit longer because of the multiple responsibilities that they have outside of school. So again, I think that's important for us to recognize. And again, the MSW program, exciting opportunity is that it's also at the Shady Grove campus. And so that provides students, again, both in psychology and social work, a path to the MSW right here in Montgomery County. Joan, do you want to?
Yeah, thank you, Katie. And thank you guys so much for having us today. I'm the director of the Masters of Social Work program at UMB, and we have a very tight relationship with the Bachelors of Social Work program, which Katie's the director of, which is UMBC, but we still work very closely together. We're really excited about our expansion at the University of Shady Grove. So about 5 years ago, we brought the full MSW program to Shady Grove, and we have practically doubled our enrollment since then. And we have a specialization in behavioral health, and now we have a specialization in children and families as well. I'd say the main point that I would like to make in recruiting diverse MSW students and ultimately practitioners for the community is, as many of you have said, the importance of financial resources in supporting that pathway. And so we have several great scholarship and fellowship opportunities that do that. One is the Title IV-E program, which we work closely with the HHS in providing a pretty substantial stipend, and then they have a required work requirement to serve in DSS after the MSW. But we also have a program in substance use. It's a behavioral health fellowship where, again, they almost get a full tuition reimbursement and have a requirement to work in substance use after they complete the MSW. We have a great percentage of pass rate on the licensing exam, which is awesome. So we are providing a lot of licensed practitioners coming out of our program that are going right into Montgomery County to fill those needs. But again, I mean, it's just so great to kind of hear from all you and meet. Some of you I've met, some of you I haven't met. We'd love to continue the partnerships, especially in expanding employment-based field placements. That's really, and I know several of you guys have talked about that. We'd love to expand our opportunities at Montgomery County Public School System. I know there's been some barriers with getting social work interns there. But I think those having employment-based field placements so that students of color or that, people are in the field who are in these other positions that are interested, and especially first generation or practitioners of color or Hispanic folks want to get their master's degree. It really helps if they can stay in their employment and do their field placement in a different part of the organization, and have that kind of support really helps, and then scholarships. So I think those were our main points. We, Katie and I, were texting with one another saying we definitely wanted to be short so that we could allow time for discussion. So we'll be short.
Well, thank you guys very much. And to everybody, I really want to say thank you for these incredible presentations. Certainly there's a lot of thought that's been put into how individually you guys can address some of the issues. I'm not going to belabor that, so we can go right into questions and comments. I'm going to turn to Councilmember Jawando, who's the first one, but let me just say something very briefly. That's a story about an interaction or something that happened here in Montgomery County. So my cousin, who basically grew up as my younger sister, actually had her LGPC and had applied for a job with Montgomery County in HHS, but was told because she wasn't able to work full time, she had a young child, was a single mom, and so she could only work part time. She needed to either reapply once she was able to work full time, or once she became fully licensed as an LGPC. And so I'm sure that that's typical, and I'm not just speaking from this, and of course I don't get involved as an elected official for a family member, but it's something that I want to bring up because, again, as we think about how it is that we're going to reach into our communities, understanding that our communities do have some nuanced needs, and so being a single mom raising a very young child and not being able to do everything exactly, we might need to look at ways in which we can be more flexible in terms of allowing folks to continue to work in the industry while still doing some of the other things that they need to do. That's a part of that growing of the diversity and really allowing for folks to be able to enter into the field. So with that, let me turn to Councilmember Jawando.
Thank you, Mr. Chair. And as always, great segue. This was a lot to process, and it was very well done. And I think Dr. Crowell, if he's still with us, said it was more of a symposium. So I wrote down several points. I will move quickly because I want to make sure other colleagues have an opportunity, but I wanted a mix of a couple points and then maybe a question and a half. So just stepping back to the importance of this, Dr. Kroll started us off talking about, or I think Mr. Rice talked about This Is Us. And, and some people know, everyone can find their lives in that show because it's such a great show. But, in particular with the lead character, I often have a lot of similarities with him. I took care of my ill father who passed away from cancer and then ran for office, and many, many similarities. And I actually had to stop watching the show in the first year because it was when my dad was really, really sick and I just couldn't handle watching it. And so my wife and I now, we're catching up. And I mentioned that to say that this issue of mental health and being able to process it, what you're going through, whatever you're going through, and all of us are going through something, but having a culturally appropriate, someone who understands what you're dealing with, the background, it's just such a critical thing. And then when I heard Dr. Kroll say, well, he's been reached out to, and I'll be transparent with him, I've actually reached out to him for a Black therapist. So when he was saying that, he's talking about me, and I'm sure there's many other people. And he obliged and did that, and I'm appreciative. And so I just say that to say, just to be vulnerable, because we know how much of a challenge, and this is a very real thing from our youngest children to our most senior adults. And this is a serious, serious pipeline issue. So I really appreciate everyone working on it. So a couple points. If we were to do one of these word cluster diagrams, that's where you see all the words, and then the thing that's said the most is the biggest word. Complications, challenges, barriers would have probably been the word that is one of the three biggest that we would see today. And a lot of those are in relation to whether they be state or other regulations, or state board of education, or state health and human department of health. I'm sure there's county things that get in the way. And so I want to ask specifically, we mention them almost as if it's insurmountable. And I know people are trying to do it, and that we've accepted that they're there. And I just think, Councilmember Albernoz said this at the beginning, this is a public health emergency. And we declared racism a public health emergency. This is related to that because because the racism embedded in all of our systems, including our mental health system, is there and denies people the help they need. So, okay, we've established it's an emergency. We've established that there are multiple barriers and multiple levels of bureaucracy. So what if we could get our state delegation, we're sending our letter to them, or we might have this week, about what our priorities are. Today, we sent a letter on what are the priorities that we want them to accomplish in Annapolis. This should have been on the letter, or we can accompany it or go back to them. And this, when I say this, and I want to ask, maybe we start with, I want to hear from the superintendent perspective, but also Dr. Crowell maybe, and anyone else who wants to chime in. If we could snap our fingers and change the certification so that folks, for example, coming with degrees from other countries, like, many people do here in Montgomery County in the state of Maryland, or allowing what Mr. Rice was saying, people with less, life challenges or less levels of certification. What would be the set of things that we need to put together on recommendations that we need to go lobby hard for? Because this has always been a challenge, but as has been stated, it's a crisis level. And so we have to get these barriers out of the way. And I think one of the things that should come from this is that list. And I'd love to start it now. But what are the things that we need to go and lobby, myself and others, to make sure we change so that we can get the services to people that need them in the culturally competent and appropriate service level? So maybe we start with the school system side and then go to Dr. Crowell. And that's really my main question, and then I'll pass it on.
So I appreciate that question very much, Councilmember Jawando, because it's something we talk about all the time. Way too many of these things, not only in mental health, but in lots of areas in the profession, the professional world, are binaries. Either you have all of the expertise and all of the certification, or you can't even get in the game. We've got to create entry-level jobs that are not just, task-based, but that begin you experiencing the profession. And so, as I said, I made a commitment today that we're going to work on not just having entry-level student experience in physical health, but also we're going to expand into mental health. There's nowhere for those students to go, and there is no certification, there's no licensure where they can move into an entry-level good job in the community that isn't a licensed clinical social worker or isn't a master's level whatever. And that would be, I think, the first thing that could happen, and it could happen if the professions and the Maryland State Department of Education would simply look at it and say, yeah, this is the threshold. This is what you need, like the story Craig Rice told, and there's a place for you. And instead of having to wait and so many become discouraged, that's what I think needs to happen.
Thank you.
I will very quickly add my 2 cents to that in support of everything that Dr. Smith has said, but I would add a couple of things around licensing and regulatory issues. And one of them is that our guilds who determine licensure need to be looking at ways in which foreign-born and foreign-trained professionals who come in can very quickly and clearly have a path to access to becoming licensed providers at some level in this system, whether it is under supervision of someone for some period of time, whether there are course requirements that they must take, but somehow to make that very clear to folks so there's a clear pathway. I think that we really do have to think also about financial support for folks as they matriculate through the system, whether that's local or whether that's state or federal funding to try to help folks deal with the costs that I mentioned earlier in this process of a graduate education or even an undergraduate education as things go. And then the last one for me is perhaps a model for public health support, a public health model where people are supported in their education, and in exchange they give us some time in public service, in the public service sector. Because in this county particularly, the pull for private practice and the money to be made in private practice offset against the cost of getting a graduate education makes it a very compelling pull for folks who get their licenses. So they come, they get licensed, and they go off and do something else. And I think we need to figure out a way to help folks decide to do some public health service with us, to spend time with us after we've supported, or the state or the county has supported, they're getting an advanced degree.
I appreciate that. I think that's important. So many of our public service jobs, there was some been legislation in the past to support, public service careers post school and to support people. And we have AmeriCorps and other programs, but we need to do more of that. And if you're going to grow your own, you have to have places for them to go, Dr. Smith, like you said. We can't talk about growing your own. And I think it was Dr. Pittman, and so it seems like there's a very micro level of that. And we don't have to do it on this meeting, but when Dr. Pittman from UMB or UMC, I'm not sure, UMB, said that they've doubled their number of students, but they'd like to be able to place them in clinical experience in MCPS, we got to make that happen. And if it's some state barrier, let's get it out of the way.
We made note of that. We're going to follow up. Yep.
As did I, Councilmember Juwando, just thinking that there may be some opportunities that we can collaborate on.
Awesome. Well, I appreciate this. I'm very excited, and I think this will be a working group. And thank you to Councilmember Navarro for requesting this important meeting. And I'm really excited to continue down this path. So I'll yield, Mr. Chairman. Thank you.
Thank you very much, Councilmember Juwando. And again, we are creating a list. I know that Ms. Rodriguez-Hernandez is creating these specific recommendations as follow-ups that we are then going to make sure that we come back to. So this is great. Councilmember Navarro. All right, I think there may be some technical difficulties with Councilmember Navarro. Chair Albornoz, did you want to go? Oh, no, there she is. Sorry, there we go. Councilmember Navarro, you're up. We can't hear you. We can't hear you.
Still can hear me?
There you go. Now we can. Now
you can hear me?
Yep.
I know there's something going on. I don't know what's kind of strange. But no, I wanted to say that it's clear that This Is Us must have a team of mental health professionals writing all their stories, because I literally cry every single time I watch that show. So somehow they cover all the bases. But no, thank you again, everyone, for this amazing presentation. When I was reading the packet for this, I highlighted a point where it said, that in 2013, we had a session on the same exact issue. And so this is why I think that we're definitely very well poised to hopefully come up with what I would love to see is, a very specific initiative that is super targeted, that incorporates all of you as partners. So starting as it was described with, MCPS, identifying those students that are interested in these fields, and then being able to grow that pipeline through Montgomery College, USG with their different programs, and finding a way to establish some kind of, memorandum of understanding or contract that says then you give us a number of, years if we provide support with tuition. And not only could we create a fund, but I'm sure that we could also find ways for our very generous philanthropists to create another fund that could then, expand that pool. I mean, we have programs like college tracks or ACEs. I feel like we have all the pieces, but I'm always struck by that notion. I always share this anecdote, that notion that there are places around the world, and I always talk about, India, because it was just a very random conversation I had with someone in a plane once about how, the person shared with me how, in India, if we, for example, get, contacted, let's say Germany says, hey, we're have a shortage of dentists. Then we come back, we retool the curriculum, and we say by the year, in 3, 4, 5 years, we're going to deliver these number of dentists. And the whole point is that I think that we get really caught up with the barriers and don't necessarily think outside the box so creatively. But if there are particular regulatory barriers, like Councilmember Joanda said, let's just do it. If there are ways to create, mental health support type of positions, promoters or something that doesn't require that really high level of certification, for example, could we explore that? In the school system, we have the parent community coordinators, human personnel workers. So is there some other category where we could also expand the support and maybe then provide also those, avenues to, if somebody wants to continue on and get their certification, they could. But I feel like we're kind of stuck with the barrier of peace. And as Councilmember Joanda said, it's almost like we're just kind of, decided that it's just going to be super difficult. I don't think so. When I look at the demographics of our school system, when I look at our incredible students, I know that there must be so many students who would be so interested in this. Students of color that would be, that have this kind of inclination to want to go into these amazing fields, but just don't see a way through. Just don't, So I guess as a follow-up, what I would love to do is to see is whether we can then really consider a number of scenarios where we kind of, come together, where Source Montgomery may have to be involved, and we create a really exciting partnership and initiative that we can launch and say, hey, short-term, mid-term, long-term goals of how many positions we could create, and whether there are other models. Dr. Santiago kind of mentioned that, I remember during the interview. Are there other models that we could also develop to provide that incredible support? It has been said time and time again, and I think that's especially important right now. It is very true. And I've had that conversation even with my daughters about, okay, Mom, but I want to find a Black woman as a therapist. And you don't, I don't think people understand how critical that is to feel that if, not only taking the step to try to find or acknowledge that you need to, that you need to access therapy, for example, just that step, but then to think, well, is that person really going to get me? That is huge. And for our, students, for our young people, for our community, this is really big. But I'm really excited about all the capacities that I heard today. I think we can really do this and launch a really, awesome partnership and start kind of like measuring ourselves in terms of, what we've been able to produce. So sort of like homework, I guess, for Ms. from Ms. Rodriguez, and to see if the follow-up session with everybody that's here, if we can come up with some possible proposals that we can just, go ahead and push through. But the packets were amazing. It's like writing all over them. It speaks, just the data just speaks to you when you look at the school system in particular, and you add up the student groups, and then you look at the ratios. We have opportunities here, and we should do it. So anyway, I don't have any big questions because I know the time is late. Just as a follow-up, both chairs, if we could definitely come back and entertain some possible proposals, that would be really, really exciting. Thank you.
Well, thank you very much, Councilmember Navarro, and that is certainly the intent. Let me just restate a couple things that I heard to make sure that we've got those captured, which from Councilmember Juando, I think it's really important to identify any legislative fixes that we need to, so we need to list what those are. And that includes on a local level, because again, my cousin who didn't get employed by the county, but then went to work at Case, right? It's like, I don't understand why we have private sector that would do it and, county government wouldn't. So we need to start identifying what some of those barriers are and eliminate those, whether it's just process or whether it's based on, policy changes that we need to make. Sure, Mr. Attila, please. Are you?
I was just saying, I'm willing to take on that head on, obviously. I also want to thank everybody for today for bringing this entire ecosystem of conversation together, because with our work that we realized that even the applicant pool has diversity problems in it, and it immediately shifted the question of how can we get more people interested in actually getting into the colleges. And then now I'm hearing that we need to start with the high school. And if we can actually partner with these institutions to say you will have a path forward that will solidify your ability to get in with Montgomery County, for them to advertise at a high school level to get into their institutions, using us as a path for in, is just going to be instrumentally big. I just wanted to say that. I know the time is out. I just wanted to sneak that one in. And please, for all of the local MSPB policy, position description and whatnot, we've been texting back and forth with Susan and Raymond while we're doing this. That work we can start immediately. If we need to have a separate conversation on that, more than happy to attend.
That is absolute. Go ahead, Councilmember Juan.
I was just going to say, I appreciate you putting a fine point on it, but I think from every vantage point, everyone who's on this call should, from where you sit, that list of barriers. Some might be combined into the same barrier; they might be a different side of it. But I think we need to compile that and systematically go through it and see how we can change those levers at each level of state, local, school system, certification body, whatever it is. So thank you for putting a point on that.
Absolutely. And then when it comes to Councilmember Navarro, look, she's absolutely right. A lot of this we've been looking at for so long. And so it really is one in which trying to understand how to best really tackle this, but I think head on and with what we've been doing, we've started to align. And I agree with her wholeheartedly. And I really want to thank her for, again, pushing us to do this meeting now, because this is the right time. It's always one of those where figuring out the right time in which to do some of these things. This is definitely the right time, and we can seize the opportunity. And because the need is so great, it really is exacerbated by everything that's going on. And so really when it comes to the jurisdictional practices as well, understanding the models that are addressing the diversity, understanding how it is that we have the staffing strategies that we have, and do those need to be looked at as well? It encompasses all of those things. And of course, the pathways piece, look, that is something that I think you guys have already really done a great job at starting. Nobody else has the partnerships that we do between Montgomery County Public Schools, Montgomery College, and USG. That is so unique. And that is something that we really have as a leg up on anybody else who's trying to address this issue. So let's double down on that. Let's make sure that we take that model and beef it up so that it can get these things done. Because it's interesting, somebody was texting me fast and furious and just told me that they have with the State Department, with Maryland, they actually have the Maryland Department of Labor has a skilled immigrant task force, and they focus on sending their folks to be engineers. But there's nothing about mental health professionals. So it's just very interesting in terms of where it is that the focus is, right? And so we've got to change that. We've got to change that dynamic and make sure that people understand and appreciate how important this is. I apologize. We are at the 4:30. I do not want to make my colleagues late. Mr. Chair, do you have any last words or comments that you'd like to make before we wrap up, sir?
I'm going to watch the This Is Us show this weekend. Never seen it. Sounds great. But the other thing is, I think we should schedule this session before the holidays for sure, just in the next 2 months, just to keep the momentum going, and then have a couple follow-up sessions at that point. And I'm sensitive to bandwidth. All of you are stretched so thin right now. And if we need somebody or some entity to help with coordination, don't be bashful. Because we want to make sure we get this right and provide you all with the support that you need. Everybody has the best of intentions here. We've got to make sure you're well-resourced, though, to get this right. Thank you.
Yeah,
Before we go, Mr. Chairman,
yes,
just very quickly, I forgot to to highlight the fact that the Welcome Back Center also needs to be included in this conversation, because we need to strengthen this amazing resource, and I don't feel like we're really taking advantage of it as much as we should. So I just wanted to say that, because it's not just about that pipeline, but we also have that amazing resource right there. Thank you.
No, and I think it's to the point of what we were talking about at the state level as well, right? Understanding that our immigrant community, and Councilmember Dwando had mentioned this also. I mean, when we think about folks who are in the healthcare space that are a majority immigrants, right? Who are coming from all different countries where they have certifications in their own countries, and bringing that here, I couldn't agree with you more, Councilmember Navarro. We definitely need to leverage that as a tremendous resource. And then when it comes to the language acquisition piece, right? So that helps us right away, instantly, with our language and making sure that folks and beefing that up. One of the things that I did just note, and I apologize, we're way over, just very, very quickly, is sign language. Many of you know that my mother, worked in, was provost at Gallaudet University and was at Model Secondary School for the Deaf. We have a large deaf population. And so it's interesting that we only, I think I saw on the chart, only had one person who was fluent in sign language. That's a little concerning as well. And so something that we need to take a look at as we're looking at growing the diversity. I know that there are a large pocket of family members who are fluent in sign who could easily go in that direction. And so we need to encourage that as well, make sure that we're focusing on that piece also.
Chairman Rice, I will just add that college has significant sign language, non-credit and credit programs and short-term training as well. Just one thing I'll add to the conversation, that short-term training that gives an entry-level job in this area. We have done this in early childhood and other areas. And then a path to associate degree and credit for prior learning and transfer at USGs. It's very strong model, and I think we should be pursuing that one as well.
No, thank you. Thank you, Sanjay, for that. I really, really appreciate that. That's another one we definitely need to add to the list as well. All right, well, listen, again, I apologize for the way in which we had to move through this quickly, but you all did an amazing job. Ms. Rodriguez-Hernandez, Ms. McMillan, thank you so much for all of your support in the packet. We have some clear steps, Mr. Chair. You and I will sit down and pick a date so that we can do this. Definitely, I agree. Before we break for recess would be terrific for us to just follow up on this initial list. Again, it doesn't have to, I don't want to panic folks into thinking that means like the action is happening now, but we need to recap some of this stuff and start getting some of these easy ones, the low-hanging fruit, moving. And so I think we can do that and really start to set ourselves up for next year as we come in, really being aggressive in terms of moving the needle forward. So really just want to say thank you again to everybody, to all of my colleagues on the committee, to all of the partners here today. You all did a fantastic job. We look forward to following up and working with you continuously so we can continue to grow the diversity and in our mental health profession. So really want to say thank you. All right, you guys all take care. Stay safe. We're adjourned.
implemented a procedural change for riders by